Dental Nursing Department. Environmental Health Department. Nutrition Department. Physiotherapy Department. Diploma 3 Program Studi. Diploma 4 Program Studi. Professional Program. Human Resources in Makassar State Health Polytechnic of Health Ministry. Total employees 379 people. Number of educational personnel 150 people. Number of lecturers 195 people. Number of lecturers S3 34 people. Makassar State Health Polytechnic of Health Ministry. Thousands of thousands of graduates are spread all over in the archipelago. They are at the government institution, private professional institution, and some of them have even become health entrepreneurs.
Saat ini saya bekerja di Rumah Sakit Sina Makassar sebagai dietitian, dan saya juga pernah bekerja sebagai tim base Nusantara Sehat dari program Kementerian Kesehatan untuk daerah terpencil, perbatasan, dan kepulauan. Dengan ini saya merekomendasikan kepada adik-adik untuk bisa memilih Poltekkes Kemenkes Makassar sebagai salah satu institusi kesehatan terbaik yang bisa menghasilkan lulusan tenaga kesehatan yang unggul, profesional, mandiri, dan berdaya saing tinggi. Poltekkes Makassar is the best.
Saya adalah salah satu alumni dari Politeknik Kesehatan Makassar, jurusan keperawatan tahun 2007. Ilmu kesehatan yang saya dapatkan di Politeknik Kesehatan Makassar mengantarkan saya menjadi wirausaha yang bergerak di bidang kesehatan, yang mandiri, unggul, dan berdaya saing. Politeknik Kesehatan Makassar, maju terus.
To realize the vision, mission, and the goal of Makassar State Health Polytechnic of Health Ministry has established 11 international corporations and 118 domestic corporations involved hospitals, government office, state-owned enterprises, pharmaceutical companies, and universities. Makassar State Health
Assalamualaikum warahmatullahi wabarakatuh.
as a national major of education pillar Indonesia's health program
Inform you
could
that the
achieve
webinar
through
will be
the
start
outputs
at
of Makassar State Health Polytechnic. Keep success Makassar State Health Polytechnic.
karena Assalamualaikum warahmatullahi wabarakatuh. Welcome to international webinar today. We inform you that the webinar will be start at 9:30. Thank you. Sorry, 9:30. Thank you.
Polytechnic, Makassar State Health Polytechnic of Health Ministry Poltekkes Kemenkes Makassar is one of the 38 health polytechnic institutions under the auspices of the Ministry of Health of the Republic of Indonesia. The existence is in the most strategic areas in Indonesia Center Point City of Makassar, South Sulawesi Province in eastern areas of Indonesia. Poltekkes Kemenkes Makassar is one of the most health polytechnics that will be a particular interest among the students from many areas in the motherland. Health education dynamic of an area 4.0 should be able to generate an output of professional healthcare, self-sufficient, global competitiveness in the face of advancing science and information technology. Makassar State Hal Polytechnic of Hal Ministry in expanding institution mandate of Tridharma Academy, education, research and public dedication should be able to dedicate as a professional healthcare worker.
Ya, Assalamualaikum warahmatullahi wabarakatuh. Mr.
Waalaikumsalam.
Vice Chancellor of Health Polytechnic. Let me introduce Ms. Sri Wahyuni as a moderator in this event. Ms. Sri Wahyuni, and welcome to me, Ms. Jamie Aibaum from University of Arkansas. Welcome to Health Polytechnic of Ministry of Health in Makassar, Ms. Jamie Aibaum. Okay, these events we will start in 9:30 a.m. and thanks to Dr. Insinyur Hadi Agustian Ipa, our counselor in Health Polytechnic of Ministry of Health, that has attended also in this event, an international event, and to all the participants that have joined in this event in this morning. And we will wait a few minutes more for starting this program. Miss Jamie, how do you do today?
Hi.
We hope that you are ready, and thank you for your willingness to meet our invitation today for international webinar in Indonesia.
Thank you for inviting me.
Yeah, maybe this is the first time to Indonesia, Miss Jamie. Okay, we still wait also the second speaker from Malaysia to join in this event. And also I introduce our Master of Ceremony, Ms. Yaumil Fahni Tanjung Bulu today. Okay, at the time the participants join in the Zoom webinar, at least 417, and we also live streaming in YouTube, and up to now the registered participant 4,500, and also from the head of Badan PPSDN also has joined in this event. And okay, 7 minutes more, we will open this event, and I give the time for Master of Ceremony to at first to start this program. Okay, Ms. Yomil, thank you very much, and time for you.
Thank you. Assalamualaikum warahmatullahi wabarakatuh. Good morning and salam for all of us. Welcome to international webinar today. Alhamdulillah, Alhamdulillahirabbil alamin. Assalatu wassalamu ala asrafil anbiya'i wal mursalin. Asyhadu alla ilaha illallah wa asyhadu anna Muhammadan abduhu wa rasuluh. Sadiqul wa adil amin amma ba'du. The Honorable Head of BPPSDM Health, Profesor Dr. Abdul Qadir PhD, Spesialis THT Konsultan Mars. Our respect the Chancellor of Makassar Health Polytechnic, Dr. Insinyur Haji Agustian IPA MKes. The all speakers, Jamie A. Boom PhD, Associate Professor Nutrient Direction, University of Arkansas, USA. Rosida Abdullah, Lecturer of Immunology and Serology, Management and Science University, Malaysia. Dr. Gigi Hans Lesmana MKes, Senior Lecturer in Dental Nursing Department, Makassar Health Polytechnic. Apoteker Ida Adayanti, Sarjana Sains Magister Sains, Senior Lecturer in the Pharmacy Department of Makassar Health Polytechnic. Nurse Sri Wahyuni Escape MN, moderator in this international webinar, and all participants of the international webinar. On this opportunity, let's take a moment to give thanks for the presence of God because of this permission and grace, so that we can attend an international webinar event organized by Makassar Health Polytechnic. To make time efficient, by saying Bismillahirrahmanirrahim, the international webinar event today we begin. The next agenda is the remix from the head of committee, the international webinar to M. Askar Escape Nurse MCAS, time for us.
Assalamualaikum warahmatullahi wabarakatuh. Good morning and have a wonderful day. Welcome to our international webinar today, presented by Health Polytechnic of Ministry of Health in Makassar, Indonesia. All praise is due to Allah for His generous giving. We praise Him as it ought to be and are grateful to Him for all the favors He bestowed upon us. The Honorable Head of Badan PPSDM Ministry of Health of Republic of Indonesia. My thanks to the Honorable, our Chancellor, Dr. Insinyur Haji Agustian IPA MKes, has entrusted us to prepare this international event. We convey our grateful to invited speaker, Ms. Jamie E. I. Baum, PhD from the University of Arkansas, United States of America, and Puan Rosida Abdullah from Management and Science University, Malaysia, for the willingness to fulfill our invitation. And then my appreciation to Mr. Hans Lesmana and Ms. Ida Idayanti from Health Polytechnic of the Ministry of Health in Makassar to take a part as the internal speaker in this event. As a chairman of the committee, let me say thanks to all committee who has worked extraordinarily to prepare this event. My appreciation also I convey to all participants who have registered and are following this event. Thanks for the time spent and may this webinar provide you valuable knowledge and benefits for facing the pandemic of COVID-19. I report that this event followed by participants not only from Indonesia, but also from United States and Malaysia. The total participants registered for this event are 417 and more participants. The capacity on our Zoom is 500 participants and others following this event by YouTube channel of Polytechnic Ministry of Health. Finally, let's enjoy the webinar, and on behalf of the committee, please apologize to us if there's any mistakes during this event. Thank you so much, and Assalamualaikum warahmatullahi wabarakatuh. Thank you.
Thanks to Emaskar Escape NS MCAS. Ladies and gentlemen, the next agenda is the remarks from the Chancellor of Makassar Health Polytechnic, Dr. Insinyur Haji Agustian IPA MCAS. Time for us.
Assalamualaikum Pak Syar.
Waalaikumsalam warahmatullahi wabarakatuh.
Sudah bergabung Pak? Ini belum kan, Prof?
Sudah.
Aku baru ajudannya saja Pak. Narasumber sudah bergabung?
Sudah waktu kesempatan Pak Dir untuk sambutan. Silakan,
sekarang Pak. Sudah bisa ya. Pak? Belum?
Sudah Pak, sudah. Silakan.
Oke, baik. Baik, bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you for yeah. Good morning and have a nice day for all you today in this morning. The Excellencies, Head of Badan PPSDM Ministry of Health, Republic of Indonesia, Prof. Dr. Abdul Qadir, thank you for the time for attending this event and your willingness to open this international event of Makassar Health Polytechnic. Our respected invited speaker, Mrs. Jamie Baum, PhD, from Arkansas University, Nutrition Director, United States. Thank you for joining us today. Puan Rosida Abdullah, Immunology and Serology Faculty of Health and Life Science, MSU, Management Science University, Malaysia. Thank you for joining us today. Internet speaker from Health Polytechnic, Ministry of Health Makassar, Dr. Hans Lesmana, and Mrs. Ida Idayanti from Pharmacist, and our moderator, Sri Wasyuni. I also convey my great appreciation for all participants that have been registered and joining this event from abroad, and general participants from all over academies, and also to all activities from Polytechnic, including lecturer, academic staff, student, and graduate. COVID-19 pandemic has changed everything in all aspects of human circumstances. Few preventive measures have been launched by WHO and the government of Republic of Indonesia, such as social distancing, hand washing, using the face mask, face shield, hand sanitizer, and many more. This government policy and behavioral change, of course, influencing human nutrition pattern in its fulfillment. Besides that, using a hand sanitizer also provoked many questions about its safety, side effect, and the regulation of new product. Besides changing in human circumstances, the brief description also needed about the human immune responses and COVID-19 infection and dental health that we know until the present, there is no effective vaccine launched for preventing the infection. We hope that this international webinar will enrich us with information about those questions. And finally, I convey my appreciation to the committee who have worked hard to prepare this event. And to all participants, happy following the webinar. Thank you very much. And Assalamualaikum warahmatullahi wabarakatuh. Thank you, Mr. Asad.
Thanks to Dr. Insinyur Haji Agustian IPA MKes. Ladies and gentlemen, the next agenda with the remarks from the head of BPPSDM Health, Profesor Dr. Abdul Qadir PhD, Spesialis THT Konsultan Mars, as well as opening an international webinar event. Please welcome. Saya buka dulu. Okay, ladies and gentlemen, wait for Head of BPPSDM Health, Profesor Dr. Abdul Qadir PhD, Spesialis THT Konsultan Mars. Allow me and these docents to read the rules of the international webinar today. I will share slide, share screen. Okay, webinar rules for participants. First, please type your complete name in Zoom or YouTube ID. Do not use the device name or your institution name. Second, point 2, all participants can ask questions. For Zoom participant can use the Q&A column. For YouTube, participant type down question, name, institution, then your question in the chat box. Please note that not all of the question can be read by the moderator due to time limit. Point 3, certificates will be given to participants who attend from the beginning to the end of the webinar. And point 4, the link of evaluation form and the attendance list will be served at the end of the event. The link will only be active for 60 minutes after the end of webinar. The link to access your certificate is available once you complete the evaluation form and attendance list. Okay, ladies and gentlemen, the next agenda with the remarks from the head of PPSDM Health, Profesor Dr. Abdul Qadir, PhD, Spesialis THT Konsultan Mars, as well as opening an international webinar event. Please welcome, Professor. Sorry, time for us. Professor Dr. Abdul Qadir, please.
Yes, the unmute.
Yeah. Thank you for all of the participants, ladies and gentlemen. Good morning. First of all, I want to thanks to all of you for attending this webinar this morning. Then I hope you can share your experience for all of the participants, and also I hope all of us we can get some advantage from this webinar. Yang terhormat Kepala Pusat Pendidikan SDM Kesehatan, Direktur Polkesmas Kemenkes Makassar beserta jajarannya, para narasumber, guest speaker from abroad, dan juga teman-teman para peserta seminar sekalian yang kami hormati. Tentunya pertama-tama marilah kita bersama-sama memanjatkan puji dan syukur kehadirat Allah Subhanahu wa taala atas limpahan rahmat dan hidayahnya yang diberikan kepada kita semua, sehingga hari ini kita bisa mengikuti international webinar dengan tema Understanding the Immune Pathology of COVID-19 and its Impact and the Disruption of Food, Nutrition, and Health. Tentunya pada kesempatan ini kami memberikan penghargaan dan terima kasih yang setinggi-tingginya kepada Rektor Polkesmas Kemenkes Makassar, dan tentunya kepada seluruh sivitas akademika yang telah memprakarsai kegiatan ini, sehingga dengan demikian webinar internasional ini dapat terlaksana dengan baik. Ladies and gentlemen, especially for our distinguished guests from abroad, once more I want to thanks to all of you and to give some appreciated for your join to our webinar, international webinar today, and then I hope you can enjoy, and then also you can share your knowledge and your experience about disruption of food, nutrition, and health during COVID-19. Terima kasih Bapak-Bapak dan Ibu-Ibu sekalian. Baiklah, minta tolong slide-nya bisa dipersiapkan. Ya, lanjut slide-nya. Ya, seperti kita ketahui bersama, bahwa coronavirus ini sudah merupakan pandemi seluruh dunia. Dan coronavirus ini adalah merupakan salah satu jenis virus yang masuk dalam corona, dan tentunya merupakan familial besar dari virus yang menyebabkan penyakit flu dari biasa sampai yang lebih parah. Kita kenal dulu mungkin disebut sebagai MERS-CoV, dan juga kita mengenal disebut sebagai SARS-CoV atau Severe Acute Respiratory Syndrome. Dan tentunya kita juga mengenal disebut sebagai coronavirus novel, adalah gelar baru yang sebelumnya telah diidentifikasi pada manusia. COVID ini telah menjangkit pada seluruh dunia, dan kita telah nyatakan sebagai pandemik. In March 11, 2020, WHO have declared that COVID-19 is a pandemic. And also, it's our government from Indonesia also declared COVID-19 a pandemic. It's one part of the national disaster in Indonesia. Slide. Ya. Kalau kita lihat dari respons ini, teman-teman sekalian, bahwa pandemi COVID-19 ini ternyata eskalasinya sangat tinggi. Dari hari ke hari pertambahan jumlah kasus semakin besar, dan juga menyebabkan banyak kematian di seluruh dunia, termasuk di Indonesia. Oleh karena itulah, maka kita harapkan bahwa di Indonesia sendiri kita dapatkan sampai hari ini per 8 Juli jam 12, the total number of COVID-19 cases in Indonesia adalah sekitar yang positif kita dapatkan sekitar 68.079, kemudian di samping itu yang sembuh adalah sekitar 31.585, dan meninggal dunia sekitar 3.000 lebih. Dan sayangnya ternyata COVID-19 ini head spread in 34 provinces in Indonesia. Seperti itu. Oleh karena itu kita harapkan bahwa Bapak-Bapak dan Ibu sekalian tentunya kita harus melihat bahwa in daily case graph is showing for us that for every day our cases in Indonesia have increased. Slide please. Slide please, slide. Yeah. Now I want to continue. How about the impact of COVID-19 on food, nutrition, and health? According to our slides, you can show to all of you that COVID-19 have impact malnutrition and also undernutrition may exacerbate in COVID-19. Dan tentunya kita harapkan bahwa malnutrisi ini akan terhubung kuat, akan menyebabkan kurang gizi, yang akan memperparah COVID-19. Dan salah satu penyakit yang selama ini tentunya sangat berkaitan dengan COVID-19 itu yang disebut sebagai comorbid. Salah satunya adalah adanya obesity, yang adanya tentunya malnutrition. Ini sangat berhubungan dengan gizi dihubungkan dengan kondisi sakit yang lebih parah. Di samping itu juga didapatkan bahwa ternyata COVID-19 ini berdampak pada penurunan PDB kita. Dan sekitar 6-10% akan memaksa lebih banyak masyarakat kemiskinan dan malnutrisi berat. Dengan adanya COVID-19 ini masyarakat semakin miskin. Dan adanya karena semakin miskin, maka tentunya menyebabkan asupan gizinya juga semakin berkurang. Dan karena asupan gizi semakin berkurang, tentunya daya tahan tubuh atau imunitasnya juga semakin menurun. Oleh karena imunitas semakin menurun, maka ini tentunya juga akan menyebabkan insiden COVID-19 semakin meningkat. Seperti itu yang terjadi. Oleh karena itu memang COVID-19 ini mengacaukan kehidupan kita, dan tentunya dalam waktu bersamaan produksi, transportasi, dan penyimpanan penjual berbagai bahan makanan itu akan terganggu. Slide please. Sekarang bagaimana kondisi di dalam pada tahap sekarang ini, di mana kita tetap akan memasuki kondisi yang disebut sebagai new normal era atau tatanan kehidupan baru. Bagian pertama ada 5 tahap protokol masyarakat produktif dan aman. Yang pertama adalah kita harus melakukan pembatasan kota yang memiliki klasifikasi hijau. Artinya pengurangan pembatasan kota. Jadi dulu yang PSBB, maka yang hijau itu dilonggarkan. Supaya apa? Supaya ekonomi kita bisa berjalan, kehidupan sosial kita bisa berjalan, sehingga dengan demikian kehidupan kita bisa berlanjut seperti itu. Yang kedua, tentunya ada perkebunan, pertanian, dan peternakan itu dilonggarkan, sehingga dengan demikian transportasi barang bisa jalan. Tahap ketiga adalah kita akan memilih provinsi sesuai dengan kriteria WHO untuk menjalankan adaptasi kebiasaan baru. Jadi provinsi-provinsi yang terpilih sebagai misalnya daerah green area misalnya atau daerah hijau, itu kita anjurkan untuk melakukan new normal culture seperti itu atau adaptasi kebiasaan baru. Dan tentunya dengan adanya adaptasi ini, maka tentunya kita harapkan di daerah wisata dan juga tentunya di bidang pendidikan itu bisa dilaksanakan. Oleh karena itu, teman-teman sekalian, yang paling penting bahwa kita ini tentunya tidak akan bisa hidup tanpa ada COVID-19. COVID-19 ini, virus COVID-19 ini sudah merupakan bagian dari kehidupan kita. Dia tetap ada dalam kehidupan kita dan kita tetap akan hidup bersama dengan mereka. Oleh karena itu yang paling penting buat kita adalah bagaimana kita bisa hidup berdamai dengan virus COVID-19 dengan tetap menerapkan new normal era atau tatanan kehidupan baru, dan yang paling utama adalah melaksanakan yang disebut sebagai protokol kesehatan. Slide. Slide. Slide please. Ya, lanjut. The next slide. Ya. Ini kira-kira tiga langkah kunci menuju zona aman, teman-teman sekalian. Pertama adalah untuk daerah yang aman dari COVID-19, masyarakatnya akan dapat lebih produktif dan kompetitif. Oleh karena itu kita harapkan bahwa di antara kita semua betul-betul harus ada gotong royong multi pihak untuk mewujudkan daerah yang masing-masing semakin turun tingkat risikonya. Di samping itu kita harapkan adanya kolaboratif pemerintah dan masyarakat, di antara pemerintah daerah dan masyarakat itu harus bekerja sama, berdisiplin menjalankan adaptasi kebiasaan baru. Ya harapkan jangan sampai kita lengah, jangan sampai kita selalu keluar tanpa menggunakan masker dan sebagainya. Kita tetap harus melakukan social distancing, physical distancing, hand washing, dan juga tentunya bagaimana kita melakukan sesuatu yang disebut sebagai protokol kesehatan itu dilakukan secara disiplin. Teman-teman sekalian, slide please. Slide. Ya, teman-teman sekalian, untuk bisa menerapkan yang disebut sebagai healthy campus atau healthy promoting university, maka tentunya yang paling penting buat kita semua adalah pertama harus ada komitmen dulu. Komitmen dan kebijakan pimpinan universitas. Pimpinan universitas betul-betul mempunyai visi, mempunyai komitmen bahwa dia akan membangun yang disebut sebagai healthy campus atau healthy promoting university. Yang pertama, tanpa komitmen pimpinan tentunya tidak akan jalan. Kalau misalnya sudah ada komitmen itu, maka tentunya pimpinan akan memberikan sosialisasi dan penegasan kepada semua staf dan mahasiswa untuk melakukan yang disebut sebagai bagaimana menciptakan staf dan mahasiswa yang sehat. Tapi untuk mendukung mahasiswa menjadi sehat, staf kita menjadi sehat, tentunya diperlukan lingkungan sosial dan fisik yang mendukung perilaku sehat. Oleh karena itulah maka tentunya kita harapkan bahwa perilaku sehat ini harus menjadi budaya dari kita semua, sehingga kita senantiasa melakukan peningkatan kapasitas individu untuk tetap hidup sehat. Dan tetap menyelenggarakan kegiatan akademik tentang kesehatan, baik dalam pendidikan maupun penelitian. Oleh karena itulah maka saya kira harapan kita ke depannya, semua kampus-kampus di Indonesia dapat menerapkan prinsip-prinsip healthy campus and healthy promoting university. Lanjut, slide please. Next slide. Nah, oleh karena itu, maka bagaimana kita bisa menjaga untuk dapatkan food and nutrition yang bagus seperti itu. Tentunya untuk itu kita harus mengacu kepada WHO tentang pangan dan gizi, khususnya yang menjalankan karantina dan tentunya yang mengalami isolasi mandiri. Pertama adalah make a plan, buatlah perencanaan, take only what you need. Oleh karena itu dikarenakan adanya pandemik, maka tentunya kita harus cuma membelikan atau membeli sesuatu yang memang kita butuhkan. Janganlah membeli sesuatu di supermarket atau di pasar berlebih-lebihan, kemudian di stok di rumah, akhirnya nanti akan mengalami kerusakan. Ini juga akan menyebabkan jatah orang lain yang semestinya juga mendapatkan makanan itu hilang. Kenapa? Karena kita akan memborong. Oleh karena itu, maka kita semua harus membuat dan disebut sebagai make a plan, buat perencanaan, kemudian take only what you need, buy only what you need. Don't buy you don't need, seperti itu. Jangan beli kalau yang tidak dibutuhkan, seperti itu. Yang kedua adalah gunakan bahan pangan segar. Utama adalah bahan-bahan segar. Sedapat mungkin jangan mengisi kulkas kita dengan banyak bahan makanan yang justru akan menyebabkan bahan makanan itu mengalami kerusakan atau penurunan kandungan gizinya. Oleh karena itu kita harapkan kita harus menjadi bijak. Ya, yang ketiga adalah prepare home cooked meals or take advantage of free options. Artinya apa? Masa pandemi ini sedapat mungkin kita menggunakan atau memasak sendiri di rumah. Jadi kita harus lebih banyak memasak sendiri di rumah karena waktu kita sangat banyak, karena kita kan kerja from home. Tapi jika tidak memungkinkan, gunakan jasa pembuatan atau pengiriman dan transportasi makanan yang terpercaya, yang mematuhi aturan ketat hygiene dan makanan. Oleh karena itu disarankan bahwa di dalam pengiriman makanan itu disimpan pada suhu di bawah 5 derajat atau di atas 60 derajat Celcius. Supaya apa? Supaya tidak mengalami kerusakan di dalam perjalanan pada saat delivery. Yang selanjutnya adalah dalam masa pandemi ini disarankan juga be aware of portion sizes, salt intake, sugar intake, and fat intake. Jadi kita betul-betul harus bisa makan jangan berlebihan, makan sesuai dengan kebutuhan kita. Kemudian kita ngatur betul porsi makanan kita sesuai dengan kebutuhan kita, sesuai dengan asupan garam yang cocok atau asupan gula yang cocok dan asupan lemak yang cocok seperti itu. Adalah kita harus mengikuti proses bagaimana kita bisa melakukan pengolahan makanan ini seperti itu. Dan mencegah stagnasi pangan. Penting adalah hygiene seperti itu. Adalah pertama tentunya kalau kita mau seperti yang bisa lanjut teman-teman sekalian antara mentang teman-teman sekalian, next slide. Next slide.
Okay, we are sorry, we still waiting for Mr. Badan.
Tapi kita mengatur jarak seperti shopping post yang akan kita
Okay, excuse me, there is any, the voice is any trouble?
Yeah, because an unstable connection in Jakarta, I think, not in in Makassar, it's in Jakarta.
Okay, let me await a moment, please. And still waiting for Mr. Abdul Qadir screen.
Oke, slide berikutnya kasih aku cepat. Satu slide lagi. Oke. Teman-teman sekalian, yang terakhir adalah bagaimana kita melakukan health promoting ini normal. Yang paling penting because we have to enter a new normal era, dan very important for all of us, how to wear face masker. Bagaimana menggunakan masker dengan benar. Kadang-kadang kita memakai masker, tetapi hidung kita tetap terbuka seperti itu. Oleh karena itu kita harapkan bahwa bagaimanapun juga penggunaan masker ini betul-betul harus kita pelajari sehingga dapat menutup semua saluran pernapasan kita termasuk hidung dan mulut kita. Yang kedua, how to implementing physical distancing. Ini penting buat kita. Physical distancing dengan jarak minimal 1 meter antara satu dengan lain. Jangan lagi kita dapatkan sesuatu kerumunan yang luar biasa dari masyarakat kita. Kemudian membuat satu kebudayaan how to wash hand using soap. Bagaimana kita membuat semacam kebiasaan untuk hand washing, cuci tangan. Cuci tangan ini penting buat kita semua. Bila mana kita baru pulang dari kantor atau dari belanja misalnya, yang pertama kali kita lakukan sebelum sampai masuk ke dalam rumah adalah melakukan cuci tangan di bawah air sabun. Seperti itu. Kemudian, how to improve our immunity. Improving our immunity, it's very important for all of us, adalah healthy diet. Kita harus bisa makan makanan yang healthy, yang sehat seperti itu. Kemudian don't forget to exercise for every day at least 10 minutes. Minimal 10 menit kita harus olahraga. Kemudian kita tentunya harus bagaimana how to reduce smoking, how to reduce no smoking. Seperti jadi kita harus berada di dalam area no smoking zone. Dapat mungkin tidak ada rokok di sekitar kita karena rokok itu membawa bencana dan penyakit buat kita semua. Dan yang terakhir adalah tentunya how to improving our health literacy. Ini penting sekali buat kita bagaimana masyarakat kita mengerti tentang kesehatan itu. Dan untuk itu maka tentunya yang paling penting buat kita adalah how to build a healthy culture, budaya kesehat daripada masyarakat kita. Ini penting. Terakhir barangkali saya ucapkan sekali lagi kepada anak teman-teman sekalian, bagaimana kita semua untuk bisa melawan COVID-19 ini adalah yang utama adalah how to collaborate in each other, how collaboration involving all parties, including faculty, academic society, in higher education institution. It's very important for all of us. Oleh karena itu, sebagai terakhir saya ingin pesankan, marilah kita bersama-sama, bergandengan tangan, berkolaborasi, bekerja sama, bergotong royong, untuk bisa bersama-sama melawan pandemi COVID-19 ini. Tanpa dukungan dari kita semua, mulai dari pemerintah, masyarakat, akademisi, dan fakultas, maka tentunya penyelesaian pandemi COVID-19 ini tidak bisa berlangsung dengan baik. Saya kira itu saya sampaikan. Terima kasih. Wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Terima kasih, Prof.
Sorry, Professor. As we'll opening an international webinar event, please. Sorry, Professor Dr. Abdul Qadir, please, as always, opening an international webinar event.
I am still here. Okay, please. I still join the international webinar now, please.
Could you please to open this webinar seminars, Prof?
Oke. Dengan ucapan Bismillahirrahmanirrahim, maka dengan ini international webinar mengenai COVID-19 its impact and on food, nutrition and health, saya nyatakan dibuka dengan resmi. Terima kasih Bapak dan Ibu sekalian, selamat mengikuti seminar. Mudah-mudahan webinar ini bisa bermanfaat untuk kita semua.
Thank you, Prof, for joining us today.
Thank you. Thank you, Profesor Dr. Abdul Qadir, PhD, spesialis THT Mars. Ladies and gentlemen, the next agenda was presentation topic all speakers. But before I present the next agenda to moderator, furthermore, the following agenda will be guided by our moderator, Nurse Sri Wahyuni Eskep, MN. But beforehand, allow me to read the biography of him. Okay, I want to share screen. Please, host, I want to share
kalau
screen.
Bapak mau permisi, mungkin setelah bicara sebentar, ya.
Okay, curriculum vitae of moderator. Name is Nurse Riwahyuni Awaludin Escape. Date of birth, the 3rd of October 1973. Position, senior lecturer in Nurse Department of Makassar Health Polytechnic. Education background, program Diploma Nursing Akper Depkes Banta-Bantayang Ujung Pandang. Bachelor of Nursing Erlangga University in Surabaya. Program Nurse in Erlangga University Surabaya and Master of Nursing from University of Technology Sydney. And work experience, lecturer of Akper Depkes Ujung Pandang and now lecturer of Makassar Health Polytechnic. And the moderator has been a guest speaker and webinar and workshop and has a book that been published. Okay, for this reason, I invite the moderator to be able to guide the topic presentation session today. To Nurse Riwahyuni Escape MN, time is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you very much.
Assalamualaikum warahmatullahi wabarakatuh.
Thank you
Morning,
very much.
Bu Wayuni.
Good morning, sir. Good morning, everyone. Hello.
How is today? Yeah.
I'm fine. Thank you very much.
Okay, please, Ms. Wayuni.
Thank you. Let me open this webinar. Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen. Welcome to Makassar Health Polytechnic International Webinar with the theme Understanding the Immune Pathology of COVID-19 and its Impact on the Disruption of Food, Nutrition, and Health. I'm Sri Wahyuni Awaludin. It is my honor to be a moderator for this webinar. Today we are going to have 4 presentations. I would like to introduce our speakers today. First, our speaker is Dr. Jamie A. Baum, PhD from United States of America. Our second speaker is Puan Rosida Abdullah from Malaysia. Our third speaker is Dr. Gigi Hans Lesmana MKes from Dental Nursing Department, Polkesmas, Makassar. And our fourth speaker is Apoteker Ida Adayanti, SSE, MSc from Pharmacy Department, Polkesmas, Makassar. Now, I would like to invite Dr. Baum to come to our webinar room. Please, Dr. Baum.
Morning, Dr. Baum.
Are you joining us now?
Yeah, morning. I'm Agus from Health Polytechnic of Makassar. Thank you for joining us today.
Thank you for inviting me.
Yeah, is this your first time for joining us?
For what? This is my first time presenting, I guess, at bedtime.
Okay. Thank you very much for coming to our webinar. We're really pleased to meet you, Dr. Jamie. First of all, I would like to introduce you to the participants by reading your CV just for a short while. Is it okay?
Yes.
Okay, thank you. So I would like to share screen and showing to the participants your short CV. Okay, so Jamie A. Baum, PhD. Dr. Jamie Baum is an associate professor in the Department of Food Science and director of the Center of Human Nutrition at the University of Arkansas. Dr. Baum received her PhD in nutritional science from the University of Illinois and completed a postdoctoral fellowship in cellular and molecular physiology at the Penn State College of Medicine. Dr. Baum worked as a nutrition scientist in the food industry in the Netherlands for over 5 years. In 2019, Dr. Baum was selected to be a Counselor's Fellow to lead an initiative in food systems and the future of food at the University of Arkansas. She currently serves as the chair of the Nutrition Physiology Interest Group with the American Physiological Society. Dr. Baum's research addressed challenges related to nutrition and its impact on health. So, ladies and gentlemen, if you would like to know furthermore about her research, you can visit her website here, website nutrition.uark.edu. Okay. So now it's time for Dr. Baum to present her presentation. Your time is 45 minutes for presentation and then followed by 15 minutes for question and answer. Time is yours.
Great. I think you have to stop sharing your screen so I can share my screen, I think. Okay, perfect.
Thank you. Thank you to remind me.
Let's see if it. Do you see slides?
Not yet.
Yeah, okay, let's try this again. Okay, I may have to quit and then come right back.
Okay, no problem.
Assalamualaikum, Puan Rasida. Assalamualaikum. Masih unmute, Puan Rasida. Bisa disapa Bu Wayuni dari Puan Rasida dulu.
Halo.
Assalamualaikum.
Ya, terima kasih bergabung bersama kami.
Sama-sama.
Ya. Apa kabar? Malaysia sudah nol cases ya sudah. Oh, sudah bergabung lagi.
Malaysia. Yesterday I think there's case.
Okay.
Okay.
Okay, I think it should work.
So now we return to Dr. Baum. Are you ready now?
Yes, should work. Now do you see slides?
Yes, I see your slide.
Perfect. Let me just make this. Okay, and I close the video. So today I'm going to talk to you about the disruption of food, nutrition, and health during social distancing and COVID-19. And we heard a nice introduction to some of the concepts I'll present in more detail with the keynote speaker. Oops. So just to disclose that I have no potential or actual conflicts of interest in relation to this program or presentation, and below are the areas where I've received funding. So the key messages I hope you're able to take away today are more information about food, nutrition, and health before COVID-19, the current state of COVID-19 and the individuals at risk, the impact of COVID-19 guidelines on food, nutrition, and health, and nutrition and health recommendations moving forward, and the role of the food system. So I'd like to just start with a definition, the definition I chose for food systems to present today. And the food system is a complex web of activities that involve the production, processing, transport, and consumption of the food we eat. And issues concerning the food system include the governance and economics of food production, its sustainability, the degree to which we waste food, how food production affects the natural environment, and most importantly, in today's times, is the impact of food on individual and population health. So this is just a complex example of a food system. You can see that food systems are complex and there's many parts. And food systems can be global, national, regional, and local. They all play a role, and there can be food systems within the food system. And key components to the food system include environment. So it's important to think of our water, our soil, our climate, and sustainability. Food production, how we distribute our food, and the nutrition and health outcomes. So why do we think the food system is important, or why is it important? It's because we want to focus on delivering safe, nutritious food in a sustainable way to ensure the health and well-being of the global population. So there's several key drivers of the food system. So the food system includes not only basic elements of how we get our food from farm to fork, but also all of the processes and infrastructure involved in feeding a population. And like I said previously, systems can exist within systems. So we have our whole farming system, agricultural ecosystems, economic systems, social structures, and all of these impact how the food that we eat gets to our table. And most importantly is population health. So this is really what I believe is the key factor in addressing food system challenges, because the whole reason we produce food is so we can eat and stay alive. And as nutrition-related chronic diseases like obesity, diabetes, and cardiovascular disease contribute to the global burden of disease, they also seem to be putting us at most risk for COVID-19, for contracting COVID-19. So this is my interpretation of the food system. It's a lot more simple, and it's how we interpret the food system, I think, within university where I work. So I really view it as 4 connecting parts. So food production and processing, food distribution, the environment, and nutrition, health, and well-being. But all of these factors are impacted by our behaviors, our policies or laws, outreach and communication, education, and economics. So no part of the food system can exist alone. So this was a screenshot I took from the World Health Organization Corona dashboard yesterday. So clearly the numbers are going to be higher. But as we all know, at the end of 2019, SARS-CoV-2 or COVID-19 started to spread, and today it's officially a global pandemic. And on July 7th, there were more than 11 million cases and more than 535,000 deaths. And this rapid spread of COVID-19 and the quarantine and social distancing measures that have been put in place have greatly impacted our food system and will continue to impact our food system in the near and not so distant future. So what are some of the current challenges that we're facing with the food system during COVID-19? So we have the challenge of how to feed the growing population and how to feed this population a nutritious diet in order for us to be active and healthy and still live in a society that is under lockdown or social distancing to prevent the spread of the virus. And this diet should not only respond to our current challenges and future health challenges, but this is a time where our food system will be changing and have the opportunity to be rebuilt or go in a new direction. So we need to make sure that our food system is sustained for future generations. So there's several reasons that our food system has been disrupted with the onset of this pandemic. There's been border restrictions and lockdowns, which slow harvests. This leaves millions of seasonal workers without income, and it constrains transport of food to markets. Meat processing plants, I know where I live in the United States, we're a large epicenter for poultry production. So we've had poultry plants shut down, and food markets are being forced to close. Part of it is due to issues with the food system, but also the close quarters in which employees are working allow for rapid spread of COVID-19. As a result, farmers have been burying or leaving perishable produce or dumping milk as a result of this disruption and falling consumer demand. And now people who live in city centers are struggling to access fresh foods.
Halo, Dr. Baum.
Oh, jaringannya Dr. Baum.
Halo. Hello, Dr. Baum. Are you there? Hello. It seems like it's interruption of connection, right? Hello, Dr. Bao. Hello. Huh.
There.
You're back.
Okay.
You're back.
Sorry about
Okay.
that. I was checking to see. Okay, so as we struggle to access fresh fruits and vegetables and our food supply chain, and the issues with social distancing will only continue, access to fresh, healthy food will continue to be a problem. So this represents the food system before COVID-19, and this was adapted from the Food and Agricultural Organization of the United Nations.
Hello, Dr. Bao.
Yeah.
Your screen is not here. We cannot
Oh,
see the screen. Yes.
Let me try again. I'm gonna mute my video because that might help with streaming the slides.
Okay.
Let's see.
Okay. We can see your slide.
Okay. So let me minimize the picture. So this is the food chain as represented by the Food and Agricultural Organization pre-COVID-19, and let's see. And you'll see right now we have disruptions within the food supply chain. So production, storage, processing, and markets are disrupted, and which is impacting our food environment, such as availability. And then our behaviors are changing. So we're changing where we eat, what we eat, how we're preparing food, cooking, storing, and eating, as most of us tend to stay home. And this is impacting nutrition and health outcomes. So taken together, it all impacts the availability, the accessibility, and the use of our food. So disruption of the food system is resulting in increased food insecurity. So we have loss of income from workers who are fully or partially furloughed or not working, which will impact their ability to purchase food. Stay-at-home orders and restricted physical access to either supermarkets or places where we gather to eat food will make us more food insecure. Closure or reduced capacity of institutions that support food social safety nets, so like school feeding programs, can lead to increased food insecurity. Market disruptions, so not being able to restock supermarkets, wasting fresh fruits, vegetables, and proteins. Increases in the prices of basic foods will make some unaffordable, and unexpected medical costs due to the rise in COVID-19 will contribute to food insecurity. So food distribution channels in almost all countries have been highly disrupted, and this has severe negative consequences for the most vulnerable populations. So the immediate concern is the disruption of our food systems and the impact this has on food insecurity. Our food systems directly employ over 1 billion people. So when we close borders or have quarantines, or our markets or supply chains or trades are disrupted, this will further restrict people's access to diverse nutritional food sources. And this is going to really hurt countries that are already hit hard by the virus, or in countries that are already impacted by high levels of food insecurity. So this is just an example to show how jobs and livelihoods are at risk within the food system. So you'll see on the left where it says food systems and it's shaded in green, the current jobs that are allocated to food production, processing, food service, so things like restaurants, food distribution, transportation, machinery, research development, and then how this is impacted by COVID-19. So like I said before, our food system directly employs more than 1 billion people, but measures used to control the spread of COVID-19 are putting economic putting us into an economic restriction and putting food systems jobs at risk. So you can see at-risk jobs would be about 35% are at risk of losing their job right now. And this will impact the livelihood of over 34% of those 1 billion people. So prior to the pandemic, more than 820 million people were already identified as chronically food insecure, and 135 million people were categorized at crisis level or worse. And this number is predicted to double by the end of the year due to the impact that COVID-19 is having on the food system and our food economy. So this will impact 368 million children who rely on daily school meals for nutrition. And it could push more than 50 million people into extreme poverty in this year alone. So these changes are expected to start being observed in the next 3 to 4 months as people lose their incomes and their jobs and our economy starts to slow down. And it's expected to result in another 1 million stunted children, in addition to the 144 million children under the age of 5 who are already stunted. So this picture comes from the United Nations, and this just shows globally the number of school children impacted by COVID-19 school closures and not having access to safe, nutritious food. So you can see the countries like the United States and other countries around the world, more than 10 million children in these countries are missing out at meals at school due to school closures. So you can see that this doesn't just impact adults, it's impacting children and their families. Oops. And so the most vulnerable populations for food insecurity, in addition to children, are the more than 2 billion small producers, farm laborers, rural workers, and their families. Women are at high risk. Women make up 43% of the agricultural labor force in developing countries and account for more than 2/3 of the world's 600 million poor livestock keepers. Rural youth and rural poor are at risk for food insecurity and exposure to COVID. Migrant and seasonal workers and refugees, mostly due to moving around and not having one place to stay. So this just shows where the vulnerability is in relation to food insecurity. So you can see in countries that are already at risk or have high levels of food insecurity, COVID-19 is going to make this worse. So we talk about food insecurity. So let's talk a little more about the global nutrition status and the impact this has on our health and our risk for getting COVID-19. So we talk about food insecurity, but I think it's also important to talk about the global obesity epidemic. So in 2016, more than 1.9 billion adults 18 years and older were overweight, and of this 650 million were obese. So this has tripled since the 1970s. And 39% of adults, so this is equivalent to around 39% of adults being overweight and 13 being obese. And surprisingly, 38 million children in the world under the age of 5 were overweight or obese in 2019. And then this is with children over 5 to 19, 340 million children were overweight or obese. So most of the world's population lives in countries where overweight and obesity is killing more people than being underweight. So this is just visualizing the statistics I presented on the previous slide. So you can see that across the world, there are incidences of obesity. And this is scary, and I'll show you some data on another slide because it's now showing people who are obese, especially younger people who are obese, are being admitted to the hospital with COVID-19. It seems to be a risk factor. So obesity affects all socioeconomic statuses. So this shows the prevalence of obesity at the global scale according to your socio-demographic index. So the solid lines are males, the dashed lines are females. And if we just look here at the yellow bar, I'm not sure if you can see my mouse moving, but that's the average global weight. So with the more food secure we are, the higher the obesity rate. But you can see that as we hit our teenage years, most of us tend to gain weight or become overweight and obese. And so this happens with we age, and we can see that it's been happening more and more in both children and in adults. So this shows the number of deaths by risk factor across the world in 2017. So everywhere where you see a yellow star, that's a nutrition or obesity related cause of death. So you can see almost all of these deaths by risk factor are related to poor diet and overweight or obesity. And I highlighted with the blue star low physical activity because low physical activity also contributes to obesity. So what drives obesity? Well, we know that it increases our risk for obesity and chronic disease during COVID-19. We're at increased risk because due to social distancing and not being able to maybe leave our apartments or go to the gym or participate in normal physical activity. But when we start to eat more calories than we burn, that's what causes us to gain weight. And overeating can be driven by a number of things. And later on in the talk, I'll talk about specific triggers within as a result of COVID-19. So this paper was recently published in May in The Lancet, and it demonstrated that obesity is a risk factor for COVID-19 and the primary risk factor for younger patients, as I mentioned in a previous slide. And this is important because I think, at least in the United States, when we first started hearing about COVID-19, it seemed to be a disease that was only impacting older adults, so maybe people over the age of 60. And when Italy had the outbreak, there were only 203 patients younger than 51 years admitted into the hospital, into the critical care unit. But what they have seen that so as this has progressed and we've learned more about the disease, people with hypertension, so high blood pressure, cardiovascular disease, type 2 diabetes, and pulmonary diseases were becoming more and more cases that were admitted into the hospital regardless of age. And so I think people think that because we thought it was a disease that mostly impacted older people, that younger people were taking less cautions. But in March, more and more younger patients in the United States began to be admitted into the intensive care units, and they found that the common denominator was obesity. So as they looked at this figure here, the body mass index, so a BMI over 30 is considered obese, and age in years, you can see with a lot of younger people that were admitted to the hospital, so people under the age of 51 had high body mass index. So it seemed to be directly related to body weight because these younger patients are too young to develop some of these other comorbidities like heart disease and type 2 diabetes. So this is a new finding. I mean, and this is especially concerning for the United States because, as you saw on one of the previous slides, I think we have almost 70% of Americans are overweight or obese. So people of any age with the following conditions are at increased risk of severity from COVID-19. So chronic kidney disease, chronic obstructive pulmonary disease, obesity, heart conditions, type 2 diabetes. So these are the nutrition or obesity related diseases, which are directly related to the foods we eat. So not only do we have obesity, we also have malnutrition. So taking a turn. So malnutrition or obesity used to be something that was thought of only impacting affluent countries, but now we see many low and middle income countries are facing a double burden of malnutrition. So on the right, this is a figure from the World Health Organization, and they just show that malnutrition actually impacts all regions worldwide. So what we're seeing across the globe is almost 1.9 billion adults being overweight. However, around 462 million adults are underweight. So you can see that obesity is now impacting more people than malnutrition. But in some of these low and middle income countries, they still continue to deal with problems of infectious diseases and undernutrition. There's a rapid upsurge in these non-communicable diseases related to obesity, overweight, it's particularly in the bigger city settings. And it's not uncommon to find undernutrition and obesity coexisting within the same country and oftentimes in the same household. So the children in these countries are more vulnerable to inadequate prenatal, infant, and young child nutrition, but they're also being exposed, as we heard earlier, to high fat, high sugar, high salt, high calorie, and foods, and these foods tend to be low in the vitamins and minerals we need. And I'll show you in a few slides why these foods are important in potentially helping fight COVID-19. So what are some health consequences of malnutrition? So we know that with malnutrition, they're at risk for nutrient deficiencies. So deficient low calorie intake, low protein intake, and tend to be receiving too little vitamin A, vitamin E, vitamin C, zinc, potassium, vitamin B12, and iron. This poor nutrition can lead to a weakened immune system as well as stunted growth and development. So we know that these countries where we tend to have this dual nutritional burden are also at increased risk for COVID-19. And you can see this in the number of total confirmed COVID-19 deaths as of today, July, I guess for you, yesterday. And you can see Africa, Oceania, South America, a lot of places where this food insecurity exists have the highest rate of COVID-19 deaths. So what are some nutrition and health recommendations moving forward in this time of social distancing and COVID-19, and how does this relate back to our food system? So I think it's important to remember, why do we care about our food system? Well, we want to have the right foods to eat to have ideal nutrition and health outcomes. And I would argue because we want to have high well-being and a high quality of life. So all of these, the politics, the programs, the policies that are in place that regulate our food chain, all go back to ensure that we have enough food to feed the global community. So we know that food supply right now is also having an impact on our behavior, so on consumer behavior. And some of these things may be prompting us to make unhealthy food choices. So for instance, when we go to the grocery store, we're going to look to see what's available, what are the prices, how are they packaged, because we're really concerned about hygiene in marketing and regulation. So is there restricted access to certain foods? And then our behavior will be, well, can we get it? Can we afford it? Is it easy to eat? And is it desirable? So a lot of people, now that they've been told to limit trips to the grocery store, stay home, they're choosing to buy a lot of highly overprocessed foods with longer shelf lives that will sit longer in their kitchen so they can make less trips to the store, which can lead over time. So in the US, we call it the COVID-19. So the 19 pounds are about, I guess, 10 kilos you gain from sitting inside during COVID-19. So why are people gaining weight during COVID-19? Well, part of it is due to the social distancing recommendations to prevent the spread of COVID-19. So physical distancing, keeping 6 feet or 2 arm lengths apart, both in indoor and outdoor spaces. We need to limit contact when we're running errands. So when we're going to the store or taking care of other needs, we're told to avoid crowds and keep distance at events and social gatherings, stay distance while being active, and wear face coverings. So all of this makes it difficult to maintain normal levels of physical activity. So due to the social distancing recommendations, we're seeing increases in social isolation. And this social isolation can increase our risk of heart disease, depression, dementia, and even death. It can also, like I said, lead to weight gain due to unhealthy eating and patterns and physical activity. And a study in 2015 looked at people who suffered from chronic social isolation and found that they have an increased risk of death of 29%. So, stress is also very common right now throughout the world around COVID-19. Stress about whether you're going to get the disease, stress about the economy. So, fear and worry about your own health and the health of loved ones, your financial situation, or a loss of support services you may have typically relied on. We're seeing changes in people's sleep and eating patterns. People are having more difficulty sleeping or concentrating, and this is important because lack of sleep is linked to weight gain. We see worsening of chronic health problems because people are actually reluctant to go to the doctor now for fear of contracting COVID-19. We see decrease in mental health, and we're seeing an increased dependency on tobacco, alcohol, and other substances. So this brings us to sort of well-being. So the social distancing and the quarantine, although we know it's really important to prevent the spread of COVID-19, the isolation can really impact our health. So when we think of well-being, to me, this relates to the population health or the health outcomes of the food system. So this integrates our mind and body, resulting in a more holistic approach to disease prevention and health promotion. A positive well-being outcome is meaningful for people and many people in society because it tells us that people are thinking or perceiving that their lives are going well. Measuring, tracking, and promoting well-being can be useful for multiple stakeholders involved in disease prevention and health promotion. It can help influence policy. People who are happier have a better well-being, have improved health and economic related benefits. They have decreased risk of disease and illness. They also recover faster and live longer, and they have better immune function. And people with high levels of well-being are more productive at work and more likely to come back and contribute to their communities. So the definition, according to the Center for Disease Control for well-being, is the presence of positive emotions, which I think are sometimes hard to come by right now, the absence of negative emotions like depression, satisfaction with life, and fulfillment and positive functioning. So on the right, you'll see sort of a model of well-being and all the attributes that contribute to well-being. And I would say they all fit in with the food system. So we have our physical well-being related to sleep or mood. This is also related to mental and emotional health. This is part of positive public health outcomes and can be influenced by the foods we eat, which I'll talk about in one of the next slides. Well-being is impacted by our environment. So this can impact the food we eat, the food that's available to us, by our finances. So do we have a job? What is our socioeconomic status? This will influence our access to food, whether or not we're employed. Social interaction is really important for well-being, and we can see this being impacted due to social distancing. And intellectual and spiritual needs are also very important for having positive well-being. So how do we maintain well-being during times of COVID-19? Well, it's important to try to maintain a healthy lifestyle. Having a healthy sleep pattern and getting enough sleep really is important for mental health. Eating well, and we'll talk about what those foods should be in some of the next slides. Exercising in your home when you're able to do so, if you can't make it outside or exercise safely at a social distance. Trying to avoid alcohol or drugs as a way to cope with stress. And at least in the US, we have a lot of telehealth options. So now instead of going to your doctor's office, you can have a Zoom call or a FaceTime call to save you the stress of going into the doctor. But really, having sustainable, healthy diets that contain sufficient fruits and vegetables are really important for maintaining our immunity. And I'll talk about access to fruits and vegetables in the next slide, but we know that fruits and vegetables are one of the commodities being severely impacted in our food system right now. And if people who can afford it are not able to get fruits and vegetables. Think about the people living in severe food insecurity. So we know that proper nutrition and hydration are vital. We heard that a little bit earlier today. And people who eat a well-balanced diet tend to be healthier with stronger immune systems, and they have less disease overall, and they tend to have less infectious diseases. And so eating a variety of fresh, unprocessed foods every day to get our vitamins, minerals, fibers that our body needs, and especially antioxidants, which can shown to have immune properties. And this comes from the skins of your fruits and vegetables. And like I said, drinking enough water, and we heard this earlier, avoiding sugar, fat, and salt, which will help decrease your risk of overweight and obesity, as well as chronic disease, and hopefully decrease your risk of being admitted to the ICU with COVID-19 or the critical care unit. So I see that I'm running close to time, so I won't go into a lot of detail, but cravings of comfort foods may increase during COVID-19 from stress and boredom. And it's normal to have food cravings, and it's normal to desire a specific kind of food. So when we're emotionally craving food, we have this intense desire to eat. We actively seek it out. We may constantly be thinking about food, and then all the physiological processes related to that. And women tend to have a higher prevalence for food cravings than men. And a lot of times when people are having food cravings, especially during times of stress, they're craving carbohydrates because carbohydrates encourage serotonin production, which can positively impact our mood. But if we continue to crave and eat simple carbohydrates, this can lead to weight gain over time. So we did hear earlier that choosing foods high in fiber are really important versus simple carbohydrates. We know that sleep disruption can increase stress in food intake. So you want to consume food containing or promoting the synthesis of serotonin and melatonin, especially at dinner. This could help with sleep. And these foods are like roots, leaves, fruits, seeds, or protein-based foods. They all have tryptophan, which can produce serotonin. And consuming foods that boost immune function, so fruits and vegetables, with micronutrients, so vitamins and minerals, as well as antioxidants that boost immunity. And we know that foods that have antioxidants increase the number of T cells, so these are our immune cells. And you can see foods like that have beta carotene, so orange foods like sweet potatoes and carrots, vitamin C, vitamin E, vitamin D, and zinc. So you can see that these are the foods we need to help boost immunity, but in our food insecure populations and our populations with high malnutrition, these are some of the nutrients that are deficient. And then it's harder. These are also the food groups that are becoming harder to access with the disruption of the food chain. And I'm not going to get into this complex diagram, but I just wanted to show you how different foods we eat. So our fibers, our healthy fatty acids, our zinc, beta carotene, they all have a role to play in preventing inflammation and stress on our immune system. So when we do have to think about social distancing, this is a list of healthy foods that will stay fresh 1 week or longer, so you can minimize your visits to the supermarket. You can see a lot of breads, grains, sturdy fruits and vegetables, sauces, etc., that can last a longer time. And we don't want to forget about food safety. So it's important to wash our hands with clean water and soap for 20 minutes. Wash your hands after being out in public, touching your face, coughing or sneezing, or using the bathroom. Or use hand sanitizer, especially before handling your food. And there currently is no evidence to suggest that COVID-19 can be transmitted through food or food packaging, but sharing food and beverages is discouraged. You want to maintain social distancing if you're eating away from the home or taking food from a restaurant. And just keep washing your hands to prevent spread of COVID-19. So what is the strategy for the future? We will need to strengthen our social protective systems for nutrition. Food and nutrition assistance should be at the heart of all of our programs. We should strengthen our system to have response for nutritional care. Focus on the most vulnerable groups, starting with women who play key roles in the household and essential services, and tailor our social protection programs to be nutrition sensitive. We need to integrate data platforms and accelerate the data revolution for food and nutrition, and we need to invest in a sustainable future to ensure that our food systems work better with nature for the climate and for sustainability. So this was just taken also from the United Nations last month, and it's looking at a systems approach to nutrition. So when we focus on the food system, ensuring that it's always going to deliver nutritious, safe, affordable food to those who need it most. So this is just a recap of the entire food system. Every aspect is essential for building resilience and to delivering the foods we need. So in conclusion, addressing the COVID-19 crisis requires all sectors of the food system to work together to mitigate the immediate impacts and to reshape the food system so that they support healthy diets for all and do more to make food production and consumption aligned to sustainable development. So thank you. I'm happy to take any questions. Guess I can stop sharing my screen. Let's see if the video.
Thank you very much, Dr.
Thank you. I tried to stay.
Yeah, that was a nice presentation. Thank you very much. And we have a lot of questions for you.
Okay.
Yeah, hopefully it can be answered. They can be answered within 15 minutes left.
Okay.
Yeah. Okay, I will try to find. Okay. I will read one by one for you.
Okay.
Okay, we have some question here regarding to the food security. I mean, some of the participants here asking about how to maintain the food or fruits still safe to be consumed. For example, here I will just try to conclude some of question here, which is seems similar. This is from Desi Margareta. The question is, do you think that the fruits, just the fruit which clean only by water, is it safe to be consumed? And the other question from Miftah Huljana from Nutrition Department, Tadulako University, asking which one is correct. Clean up the vegetable first, then chop it off, or just chop it off, then wash it to be clean and consumed. Please.
Okay, so for the second question, so I'm not a food safety expert, but my colleague is my best friend. So you would want to clean your vegetable or fruit first, even things maybe like a melon with a hard fruit, because if there's dirt on the outside of the fruit and you put your knife through it, you're going to take the dirt and transfer it all throughout the fruit that you would be eating. And then it's hard to get out of the surface of the fruit. And what was the first question about growing fruit?
Let me see.
Sorry.
Yeah. Which do you think that it is safe? Is it safe if the fruit just cleaned by water to clean up the virus which stick on the fruit skin?
Yeah. So I think so I don't know about coronavirus specifically in fruits or foods, but
well, let me explain something here. In Indonesia, maybe because some of us are really scared about the virus, so some of the housewives tend to clean up all the fruits with the soap liquid. So we just wonder whether it is safe to be consumed, or we just clean it with water and then consume it.
I mean, the advice that we're getting from our food safety experts here is rinsing everything just with water for 20 seconds, just like you would wash your hands.
Yeah.
Because I don't think you want to eat the soap.
Sure, sure.
But I think each place has their own recommendation. So the food safety information we're receiving is just rinse the fruits and vegetables, but we're not really receiving a lot of food safety information in the United States right now.
Yeah, what about you in United States?
Yeah, we're not receiving much information about like food safety, except, wash your hands and rinse off the fruits or vegetables, but that's most of the guideline. Just like you would do normally, because just rinsing the vegetables and drying it before cutting it or putting it on your counter to chop, it's just what you would do to get rid of other pathogens related to food safety.
Yeah. So. Okay, thank you very much for your answer. Then another question from Muhammad Askar. Do you think that COVID-19 can be transmitted from vegetable seller? Because in Makassar, government policy allow vegetable seller to pass across the sub-district for supplying fresh vegetables using motorcycle. Or this is a wrong policy? What do you think, and how should be?
Oh, that's a hard one. So I think, okay, I'm just going to put the disclaimer that I'm a nutrition scientist first.
Okay.
So I do know that there needs to be some concern, because you don't know if this person giving you the fruits or vegetables has washed their hands and if they've touched the fruit vegetables. But then I think, washing it at home, washing your hands after you've come in contact are the safest ways. And I don't think they've found yet if it's a foodborne pathogen. So I know one of my colleagues in Arkansas is working right now, because also, people who have COVID-19 can have diarrhea, and that's how pathogens in food can be spread by not washing your hands. So I think the advice is just really wash your hands and wash off your fruit and vegetables before eating them.
Yeah, that's right. Just a simple explanation that in Makassar now, we are in the third place of the biggest number of COVID-19 case in Indonesia. So it's quite scary. So that's why a lot of questions here, queuing, just asking about the safety, including how to make the food are safe to be consumed.
Yeah, okay, so I think it's the interaction with the other people that is putting more at risk, rather than, especially if you cook your food, then any heat should kill the virus.
Yeah. Okay. Yeah, I agree with that. Okay. The next question is from Wira from Fatmawati Hospital, Jakarta. The question is, what the proper diet for stress management during COVID-19?
So I think increasing, even though it may be hard, and this kind of maybe puts some fear about eating fresh fruits and vegetables, but it's really these foods that have high antioxidant capacity. So those are your fruits and vegetables that have really colorful skins on the outside. They have a lot of components and vitamins and minerals that help your immune system. But I think also trying to avoid, cookies and sweets and things that are over processed, because that can in the end make you feel worse and gain weight. And that can actually decrease your sleep and decrease your immune system. So I think lean meats are really important, because they have high iron and high B vitamins, which are important for immunity, as well as, fruits and vegetables, and then in foods that are high in fiber, because they'll help you keep fuller longer.
Okay, thank you very much for your answer. I have a question here from our new student. So I think because she's the new here, so she really wants to know more. Would you please? This is from Magfira Firdaus. In the new normal era, we should keep our body immunity by consuming food which are actually really restricted. Maybe she means here, I mean, it's not really easy to go out to find some food but on the other hand, we need to consume the healthy food. So what kind of food is consumed to keep body immunity? What kind of food is consumed to keep the body immunity?
Yeah, so again, I'll go back to, fruits and vegetables are really important, but if they're hard to access, or if meats or fish is hard to access, you can do things like beans, like dried beans or legumes like lentils.
Yes.
Maybe instead of choosing things like white rice, like choosing the whole grain versions, all of those have protective properties. And so if you can't get to fresh fruits or vegetables, but frozen options are available, frozen options will still maintain all the vitamins and minerals. You just have to be careful when cooking it.
Okay, so is there any special treatment for the fresh food to cook? Frozen food? Sorry.
Well, I think you
food.
just, when you overcook frozen food, just like when you overcook fresh food, sometimes the vitamins and minerals can come out in the cooking water. So just pay attention. So just don't overcook it. So once the water starts coming out, then you're also starting to lose the vitamins and minerals.
Okay.
Yeah.
Thank you for the answer. The next question from Desi Margareta. She's from Nutrition Science of Diponegoro University. How to increase food security in this pandemic? Thank you.
So that's a tough question. So I think I was reading an interesting article earlier today, because it's nighttime here. And it was talking about, we actually have enough food in the world right now to feed the global population. But global policies make it difficult to get the food to the people that need it most. So I think there needs to be, there has to be policy changes about importing and exporting foods and getting food to the people that need it most. Because some of the pictures we see in the United States are disturbing about the amount of fruits and vegetables that they're just leaving in the field, milk just being thrown away, poultry being, slaughtered, but not ever making it to market. So we have a huge food waste problem. So I think, unfortunately, politics play a role in our food system and make it difficult to get, excess food to the people that need it most. So I think there needs to be a policy change, honestly, if we're ever going to help really treat like the severe food insecure.
Okay, thank you. So there is another question related to your answer previously. This is from Hairunisa from Nutrition Department of Makassar Health Polytechnic. She's wondering how the Arkansas government policies related to food security and availability.
Well, we are not the best state for COVID-19. We are growing, we're one of the fastest growing states for COVID-19 cases. And we're also a state that has a high level of food insecurity. I think we're the second most food insecure state in the country. So right now, it's really hard because there's a presidential election coming up. So it's hard to change policy without upsetting people when you want to have, the vote. So we don't have any real food insecurity at the government level for our food insecure people. So where I live, 1 in 3 children goes hungry. And so what we're working on is the community food system to make sure that just the citizens are coming together to make sure children have the food that we eat, but it's not an official government policy. So.
Okay, thank you.
Yeah.
This is another question. I hope you don't mind to answer.
Oh,
it's just like, sharing the experience. This is the question from Husin Malaleng. Then he asked, he's wondering why the number of population of COVID-19 case in USA is so high. Is it related to the high risk? Is it related to high elderly? He's asking, is it related to elderly people or something like that?
I think in the beginning, when COVID came to the US, yes, it was impacting elderly. But now I think, so I live in the south of the United States, and that's where a lot more of the obesity and chronic health conditions are. So now I think they're seeing that sort of the overnutrition we have in the United States is putting people at risk, but also because we don't have a policy that's telling us to stay inside, and masks aren't required. They're just recommended. I think that's why we have such a big problem, because people are being forced back to work.
Yeah,
And
just like
so
in here in Indonesia. Yeah.
So as soon
That's
as
like that.
we, so I mean, people who choose not to wear masks, they're having, lots of parties or coming back to a job that has to work close to the next person. I think the lack of enforcement of face coverings is also contributing. But also, we're not a very healthy country to begin with, so that probably makes it worse. So.
Okay, another question is there any way how to reduce the obesity during this pandemic era?
That's a good question. I'm actually trying to write a grant to help look into this issue.
Yeah, good luck.
Yeah. So one thing we've decided is, because when I talked a lot at the end about well-being and needing to connect to someone, we started a program that every Friday we have a 30-minute call open to the community, and they can come ask us any question they want about nutrition or health, or we bring in experts related to mental health or specific diets. And we're finding that that's helping people, stay healthy or find answers to their questions, or people can connect because they don't there's a Facebook group, or maybe they can't get to the store because they have cancer, to find community people to help them get healthy food. And so we're just trying to use our community resources. And so I think maybe tracking your food, working with a friend to eat healthy food, and then it keeps you in touch digitally and gives you someone to connect with. Those are all ways to help. And try to exercise, as hard as it is to do. But YouTube has a lot of videos for free for apartment and inside exercising. So.
Okay. So this is a question from Norma Bungi Aniri from Respira Hospital, Yogyakarta. Her question is, do you think that we need to take high dose of multivitamin to boost our immune system?
So I don't think there's really any evidence that multivitamins help the immune system. And there were some papers that came out several years ago, showing that too much vitamin intake can actually have a negative effect on your health. So I think, if you can meet your vitamin needs from your diet, that's the best way, because then you're getting all the other benefits of fiber and other healthy components that you may not get in a vitamin.
So the best is fresh food, right?
Yeah, fresh fruits and vegetables.
Yeah.
Antrian panjang terjadi di pasar-pasar swalayan di Melbourne, Australia. Warga memburu berbagai.
Oops.
Somebody, please.
Okay, keep on.
Thank you.
Okay. Is that it?
A lot of questions here.
I mean, that's okay. And I also put my email address. So if you need to move, if you need the next speaker. Okay. Because I was going to say, you can always share my email address if people have questions.
Okay. Okay. So the last question is, how do you think about the safety of the food, particularly for the catering? I mean, somebody just bringing the food to the office, because now we have to go to the office now, so we lay on somebody to cater the food for us.
Yeah, so I think, that makes me nervous, because we were doing the same thing. I think you just really have to trust that the place you order from has good hand washing, is holding the food at the proper temperature, social distancing. And how we're handling the catering is they actually leave it at the door and then someone goes so that we limit the person-to-person contact. But myself, for instance, I order hot foods because just so I know they're cooked to a proper temperature. Like things like lettuce handled by other people maybe make me nervous, where you could typical foods that you would worry about food safety. Oops. Make me nervous. Sorry, that was me.
So do you often reheat your food?
Yeah.
Catering, yeah.
I mean, we just have like the microwave, so sometimes I just put it for 1 or 2 minutes to be safe, but not everyone does that. But I mean, I only order from places that I trust. So.
Yeah. Thank you for your answer. So this is one more question, and I think this will be the last. The other question will be sent to your email, I think. Okay. From Lesmita Manik, she said that she got an information that COVID-19's food is in iron. So COVID-19's consume iron. So would you like to explain that statement, please?
So to help prevent COVID-19, you consume iron, or people that, so I think that is one of the nutrients that has shown to have immune properties. But so far, there's no evidence that anything we eat can protect us from getting COVID-19. But I think people are starting to look into, does healthy diet help not make the symptoms so bad? But they still need evidence for that. So I think, but in general, I think it's probably what we've all been hearing. If you're healthier and you're physically active, you're less likely to have the hospital stay with COVID-19 than someone who's less healthy.
Okay, so I think that's all for all of the questions. Thank you very much for your nice explanation, nice presentation. I think a lot of more questions coming here. They are really happy to ask many questions to you. Okay, so I think the rest of the questions will be sent to your email. And again, thank you very much.
Thank you.
Yeah, thank you very much for coming to our webinar. We would like to see you again next time. Hopefully the COVID-19 go over soon, right away, and then you can come to Indonesia and meet us in Makassar.
That would be nice. And I also have a colleague who's an expert in food safety. So if you ever needed someone just to answer questions, and maybe I can have her help me write like a fact sheet about some food safety questions and COVID and share that.
That will be really nice. Thank you very much.
Thank you. Have a nice day.
Thank you.
For
Bye-bye.
inviting me. I appreciate it.
Thank you very much too.
Bye.
Bye-bye. Okay, so for the next, we will move to the next presenter. Hello. Miss Puan Rosida Abdullah, are you here?
Yes.
There you are. Welcome to our webinar. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Yeah, we are so pleased to meet you here, even though in the webinar. Hopefully we can meet directly when the COVID-19 just over. Yeah. Okay, so I would like to read your CV first. Is it okay?
Okay.
Thank you. Okay, so would you please stop your share screen, because I will open my share screen here. Thank you. So this is, ladies and gentlemen, this is our second speaker. Her name is Rosida Abdullah. You are very young. So Puan Rosida Abdullah, born in 1981 and received the Bachelor in Biomedical Science with honors from University Kebangsaan Malaysia in 2003. She started her career at Management and Science University, MSU, in 2005 as a tutor before further her study in Master of Biomedicine at MSU and graduated in 2013. Now, she's a lecturer at MSU. Her field of research is the development of DNA vaccine toward Toxoplasma gondii from 2019 up to now. Wow, this is really quite interesting research, yeah? Okay, so Puan Rosida Abdullah, time is yours. I just want to remind that your time for presentation is 45 minutes and then followed by 15 minutes for question and answer session. Please.
Thank you very much.
Thank you.
Okay. Assalamualaikum and a very good morning. Thank you very much to organizing committee from Makassar Health Polytechnic for inviting me to discuss our topic today, which is host-immune response to COVID-19 infection. All right, so answering Dr. Agustin question just now, yesterday in Malaysia, we only have 3 cases and no death reported. Hopefully we can win this against COVID-19. Right, so to start our lecture, to start our session today, let us recall back the history of coronavirus outbreak. So COVID-19 or caused by SARS coronavirus 2 is not the first outbreak. The first outbreak is occurred actually in 2002, where the virus known as SARS coronavirus that caused acute respiratory syndrome. And then 7 to 8 years after that, there's another outbreak known as MERS or Middle East Respiratory Syndrome in 2011. So this is caused by MERS coronavirus. So COVID-19 caused by SARS coronavirus is not a new thing. Okay, there's an outbreak before, right? So all of this virus is actually the genus of beta coronavirus, which zoonotic origin, meaning that it's transferred from animal to human, then later on from human to human. Okay, so let me recap back about a little bit about COVID-19 caused by SARS coronavirus 2. So the first cases were identified in people in Wuhan, China in December 2019. So scientists believe that the first case started with animal to human transmission. Why? Because when they study the gene of this virus, it shows that this virus has the same sequence and gene as the virus found inside bat, right? The small mammal, bat, snake, and so on. So other than that, the reports also said that the patient, the initial patient in Wuhan, China, confirmed to have link with Wuhan seafood market before the infection. So, so they suspect that the intermediate host involved with this infection is a small mammal, a snake, birds, bats, pangolins, and others. All right, so how it is spread? So since the spread of the disease is very fast, it is known that the virus spread the same way as colds as well as flu, which is through droplets. Okay, so while talking, coughing, and sneezing, the patient infected with COVID-19 will transmit the virus through their aerosolized droplet. Okay, so people that have close contact with the infected person while talking to them can get these droplets. Okay, right. Other than that, by touching contaminated object that contain the droplet also can transfer the disease to other human. Okay, so these are the common symptoms, or we call it as classic symptoms, because the symptoms is actually quite the same with all other diseases, especially the infectious diseases. So the symptoms such as fever, cough, sore throats, fatigue, shortness of breath, sudden loss of smell and taste, headache, muscle aches, as well as diarrhea, right? Some can display this symptom, while others, they don't have symptom at all. Okay, but in patient with comorbidities, it can be fatal. Okay, so before we go to the immune system, let us recall back our immune system. So our immune system consists of two main components, which are innate immunity that provide the fastest response towards infection, as well as adaptive immunity that need adaptation before they can produce the response. So example of the component under innate immunity, such as our macrophages, our dendritic cells, our basophil, eosinophil, or neutrophil, or we call it as polymorphonuclear cells, as well as our and also our neutrophil cell. So this is actually a component of immune system that function under innate immunity. And for adaptive immunity, it will involve the cellular response by our T cells. As we know, we have two types of T cells, which is our T helper cells, or also known as CD4 plus T cells, and also our CD8 plus T cell, or also known as T cytotoxic cells. So the second component under adaptive immunity will be our B cells, lymphocytes B. So these B cell and T cells will need sometimes to adapt to the infection and produce the specific immune response. So that's why we call it as adaptive. So later on, we're going to view how actually this virus affect this innate immunity as well as adaptive immunity. All right. So first, let's see the immunopathology of COVID-19. Right. Okay. So as we discussed before, the COVID-19 or SARS coronavirus 2 is actually transferred through droplet, okay, or aerosolized uptake, okay, from the infected person droplet. So this SARS coronavirus 2 is actually will bind with a receptor we call as ACE, okay, angiotensin converting enzyme 2. So this receptor actually located on the type 2 alveolar cells inside our lungs. So this virus, they have the receptor, the specific receptor for them to bind. Okay, so that's why the best way to protect ourselves from this virus is by wearing mask or by practice social distancing, because everybody will have ACE2, angiotensin converting enzyme receptor. Okay, so this receptor also located on macrophages as well as monocytes that reside inside our lungs. So what happened when the virus bind to ACE2 or ACE2? So since the ACE2 provides the entrance point, the entry point for the coronavirus to hook into and infect the host cell, so the innate immunity, such as neutrophil, as well as macrophages and monocyte, will recognize this virus, okay, through what we call as pathogen associated molecular pattern, or known as PAMPs. Okay, so PAMPs, what is it? It is actually the viral genomic RNA, or the intermediate molecules during the virus replication. Because once this virus infect the cell, the type 2 alveolar cells, they will start replicating inside the cells. So while replicating, they will produce some intermediate metabolites product, such as double stranded RNA, ribonucleic acid. So this double-stranded RNA or viral genomic DNA can be recognized by our neutrophil, monocyte, as well as macrophages, our innate immune cells. So once recognized, okay, they will bind to this antigen through a receptor such as endosomal RNA receptor, toll-like receptor, TLR, as well as cytosolic RNA sensor. Okay, once they bind, they will signal our cell to produce what we call as cytokine, the intermediates of immune response. They will produce cytokines such as interferon type 1 interferon, type 1 IFN. So here, type 1 IFN. So this type 1 IFN response is needed to signal other cells and other cells such as B cells to produce antibody. So this is what we know about the virus and how it interacts with our immune system. So this is some abbreviation that I mentioned just now. Okay. All right. So from the mechanism, we know that the virus-host interaction occur in 3 ways. Okay, the first one, the virus is actually interfere with the signaling downstream of RNA sensor directly. Okay, the second one, the virus indirectly cause an ubiquitination and degradation of RNA sensor adapter molecules, and as well as binding to IRF3 nuclear translocation. So ubiquitination is actually we call as the kiss of death. Okay, it means that the degradation of the protein. Okay, so when the protein degrades, it cannot function to protect our immune system, because we know many molecule in our immune system, it is actually a protein. Okay. So even if the type 1 IFN secreted, the virus is able to inhibit the interferon signal by decreasing the STAT phosphorylation. So STAT is actually the signal transducer and activator of transcription. So the protein cannot be translated during this process. Okay, so these are the components that observe increase or decrease in COVID-19 infection. So in severely infected patient, so they can observe that number 1 is like lymphopenia, which is the decrease of lymphocyte. Then the second one, they also can observe that in severely infected patient, there will be increase of pro-inflammatory cytokines, such as interleukin-2, interleukin-7, interleukin-10, granulocyte colony stimulating factor, IP10, or known as interferon gamma induced protein 10, MCP1, which is monocyte chemoattractant protein 1, and also MIP, macrophages inflammatory protein, and last one, TNF alpha, which is tumor necrosis factor. So since there will be lymphopenia, which is the decrease of lymphocyte B as well as lymphocyte T during the infection, so the virus can freely replicate inside the cells and will cause the sepsis, viral sepsis, as well as will worsening the inflammation inside the lungs. Okay, so this will lead to complications such as pneumonitis, acute respiratory distress syndrome, respiratory failure, shock, organ failure, or even death. So that's why the name of the virus itself is SARS, coronavirus 2. Okay, because it's closely related with our respiratory system. So if we can see here, the cytokine such as interferon gamma usually can cause fever, impact hematopoietic function, then cause the lymphopenia, okay, cause the coagulation inside the blood vessel, as well as decrease in serum protein. Okay, so you can see other cytokine as well. For example, TNF alpha also can cause fever, impact hematopoietic function, and cause lymphopenia, okay, coagulation, debilitating, as well as hyperlipidemia, or also liver damage. So this further worsening the condition in COVID-19 disease. Okay, so most of the cytokine that we see here, it is actually the innate immunity cytokine that cause the very bad inflammation inside the liver and eventually cause the damage to the lungs. Okay, so component that we can see increase in innate immune responses will be neutrophils, C-reactive protein, IP10, MCP1, MIP1A, as well as TNF alpha. So this what we call as cytokine of innate immunity. So the increase of this component will worsening the inflammatory condition in the disease progression and cause severity of infection. Okay, so that's our innate immunity. Okay. What about our adaptive immunity? Okay, which is the antibody production, right? So in our adaptive immune response, we can see that our T helper 1 or our CD4 plus cell will be the key factor. They play a dominant role in adaptive immunity towards this viral infection. So we can see that T helper 1 cells produce interferon gamma, interleukin 2, as well as TNF beta, which activate macrophages and responsible for cell-mediated immunity. So interferon gamma, interleukin 2, as well as TNF beta, it is a type of cytokine that further activate the macrophages to do the phagocytosis or to secrete the mediator for immune response. Okay. Right. So T helper cells, the cells that mainly develop in adaptive immune response. So later on, these T helper cells or CD4 plus cells will migrate to germinal center of secondary lymphoid organ, such as our lymph nodes. So inside the lymph nodes, it will interact with B lymphocytes to produce antibodies. Okay, so if we can see that in SARS coronavirus infection, the seroconversion, meaning that the state where there's no antibody found to antibody detected, is as early as 4 days onset of the disease and was found in most patients by 14 days of infection. So the longer the long-lasting specific IgG was found to be in the body as long as 2 years after infection. While for MERS coronavirus infection, seroconversion is seen at the 2nd or 3rd week of the disease onset, right? So for both type of coronavirus infection, delay and weak antibody response usually associated with severity of the infection. Okay, so this is in SARS and MERS. Okay, what about in coronavirus 2 or SARS coronavirus 2 infection? So as we know, in coronavirus 2 infection, the incubation period is 2 to 11 days. Okay, which is a very long time, before our body develop an antibody. So, but during this time, the virus can easily transmitted from one human to other human, even though there's no sign and symptom displayed. Okay, so this suggests that this virus able to evade our immune system. Right. So as conclusion, so how actually this virus evade our immune system? Okay, number one, okay, it is said that this virus able to interfere with our RNA sensor. So meaning that our immune system, such as neutrophil, macrophages, monocyte, cannot detect the RNA and the antigenic RNA or double-stranded DNA displayed during the infection. So this caused the incubation period to be very long before our immune system can detect this virus. So secondly, it is said that, so this is the example of RNA sensor site, which is attachment site here at ACE receptor, as well as during the signaling process. Okay, and it's also said that the virus is actually suppress type 1 interferon during the infection process. So type 1 interferon is very important for our body to induce adaptive immunity, which is our T helper cells, and then followed by antibody production. So, so if this type 1 interferon production is suppressed, so we cannot activate the T helper cells, and we're going to delay the antibody production. So that's how this virus is successfully invade the host cell all this while. Okay. Right. So how this virus actually works in patients with comorbidities? Okay. So so as we know that this group of patients, such as diabetic patient, hypertension, as well as cardiovascular disease, patient with cardiovascular disease, they actually much more susceptible to COVID-19 disease compared to other group. Okay, but it also depends on age as well as other factors such as obesity that we mentioned just now in previous session. All right, so it is believed that the chronic disease actually share several standard features with infectious disorder. So in this patient, the patient with diabetic, the patient with hypertension, and the patient with cardiovascular disease, so usually inside their body, they already produce high pro-inflammatory cytokine, such as what we informed just now, interleukin-2, interleukin-6, MIP, MCP, and also TNF, right? Tumor necrosis factor. So this pro-inflammatory is already increased in their body. So when they get infected by SARS coronavirus 2, the condition will be worsening because this infection also caused the what we call as cytokine storm, right? Whereby many cytokine will be secreted inside our body, and instead of produce protection towards our body, the cytokine will cause the damages to the cells, especially the lungs, and cause disability of our body to receive oxygen from the lungs. Okay. Right, so that's all from me. So these are some references that I use to refer for this session. Okay, thank you very much.
Thank you very much, Puan Rosida, for your very nice, interesting presentation.
Thank you.
Okay, so now I would like, we will move to the question and answer session.
Okay.
We have some questions here for you. First question is come from Eka Octaviani from Polkesmas Kemenkes Palembang. Thank you very much, Puan Rasida, for your explanation. So her question is, are the patients who had already recovered from COVID-19 could relapse again, or are they become carrier? Thank you.
Okay. So because there's not many information yet we gather for this COVID-19. So as for what I read and follow in social media, that so far the healed patient, they actually can be infected again with COVID-19. Okay, because in one study, when they tried to measure the antibody, so for example, in day 14, they still can detect the antibody inside the patient, positive patient for COVID-19, but 2 weeks after that, there's no more antibody detected, right?
Oh, yeah.
So cases like that. So we don't really know how actually COVID-19 affect our antibody production because of that kind of cases. But theoretically, yes, the patient should not, the patient will not get infected again, theoretically, if we refer to other type of virus, because the body already produced the antibody, specific antibody towards the virus. But in COVID-19 cases, we cannot tell, okay, because it's happened in December. So the study is ongoing, and we don't know how it's actually function. So whatever we present today is actually based on MERS and SARS, how actually the virus act in MERS as well as SARS.
Okay, thank you very much for your answer. Okay, so another question is from Haryeni, Polkesmas Padang. Miss Puan Rosida, is there any difference between, she said, is there any difference between SARS virus and coronavirus in terms of attacking the host body?
Okay, so as I presented before, the mechanism how coronavirus infect the human host cells is through ACE, angiotensin enzyme. So for all three, for SARS coronavirus as well as SARS coronavirus 2, they infect the same receptor, which is ACE2. Okay, but for MERS, they actually infect other receptor, which is phosphorylation. Okay, let me see. So MERS actually they infect other receptor, not ACE2. So that's one of the differences in host immune response.
Okay, thank you very much for your answer. Then a question from Muhammad Askar from Polkesmas Makassar. What induced cytokine storm during COVID-19 infection? Okay. And what make it differs from other virus infection? So the cytokine storm is it quite clear for you?
I can't hear you just now. The connection.
Okay, I will try. Okay, I will repeat again. This is the question from Muhammad Askar of Makassar Health Polytechnic. What induced cytokine storm during COVID-19 infection? What make it differs from other virus infection? So the cytokine storm occur.
Okay, right.
Is it clear?
For COVID-19, caused by SARS coronavirus 2, the cytokine storm is actually caused by the recognition of neutrophil and macrophages towards the antigen displayed on the infected cells. okay, such as double-stranded RNA. So actually this process is the same with other virus infection, but it is depend on which receptor that they bind. So for example, as I said, for coronavirus and SARS coronavirus 2, they bind to ACE2 receptor, but for MERS, they bind to other receptor. So they will be slightly different in the mechanism, but the cytokine storm also can happen in other virus infection.
Okay, thank you very much. The next question from Mrs. Hairunimah from Nutrient Department of Makassar Health Polytechnic. What do you think about the effectiveness of the corona vaccine? Is it effective or not?
So far, there's no vaccine produced yet for coronavirus.
Yeah, that's right.
The study show that when they try to inoculate this virus in vitro, which is in mice, there's antibody production that prevent that there will be an antibody production by the mice, and this antibody production will protect the mice towards challenge infection, meaning that when we re-inject the mice with the virus later. Okay, so from there, they conclude that the vaccine can be produced because the preliminary study show that there's the IgG produced in mice is actually can protect the mice during the challenge infection.
Okay. Thank you very much for your answer. Okay, the next question is from Kinanti M. Hayuningtyas. Dear Ms. Rosida, if there is a reinfection of COVID-19 in someone's body, is it will be more damage than the previous one? This is a nutrionist indicator.
As we said just now, theoretically, after our body produce specific antibody towards COVID-19, usually we don't get infected the second time. But for COVID-19, there's a lot we don't know about this virus, and there's a few cases whereby the antibody cannot be detected in the patient after some times. I will say yes, the reinfection will cause further damage to our organ and tissue.
So it will be more damage than the previous one, right?
Maybe.
Maybe, yeah. we need further research for that, you know.
Yeah, we need further research for that.
Okay, thank you. So the next question from Repta Dwi Septiani from Jempa Hospital, Pontianak. Based on the growing issue, is it true that avocados, bananas, and papayas are very good for warding off the COVID-19 virus?
Okay, as explained by Dr. Jamie just now, I agree with her. Yeah. The fresh food is actually very good because it's actually give nutrient to our body. So this nutrient we need for our, for example, the immune component development, which is most of it is a protein. So we need all this nutrient. But if let's say now we are in the middle of COVID-19 war for COVID-19. So, but if you want to start now, I don't think the effect is immediate because our immune system it's not like that. Okay, so meaning that you need to take care of yourself from the beginning so that your immune system will be strong. Okay, but as I said, in all human, we have ACE2 receptor. So the infection is possible, even though your immune system is strong or your immune system is weak, because ACE receptor is actually they will be there for the whole life. Okay, so this virus can infect us through this ACE receptor. So the best way to take care of yourself instead of eating fresh food, other than eating fresh food, is actually to practice social distancing and as well to wear PPE, which is personal protective equipment such as masks. Okay, so by eating the fresh food in this time with COVID-19, I don't think it will help to protect us immediately. Okay.
Thank you. Another question is from Seriaktini Hasma from the Nutrition Department of Makassar Health Polytechnic. Is it like a news developed in the community that kaju put oil? Do you know kayu putih? Minyak kayu putih?
Minyak kayu putih, I heard of it.
Yeah. Do you agree that it is useful, it is effective to help us to improve our immunity? In here in Makassar, because some of the people hear about that, so they put the kayu putih oil drops, yeah, three drops in the mask, and then they put the mask. So they believe that it will help us to make our breath become smooth and then improve our immunity, avoid the COVID-19. How do you think about that?
Okay, I think that there's possibility that it's improve our breath and so on, but still I don't think that it will protect us from COVID-19. Right? So the mask itself will protect us from COVID-19, not the minyak kayu putih.
So still keep the social distancing, right?
Yeah, still social distancing and also PPE.
Yes. Okay. Okay, another question is from Dia Aini. Why the psychosomatic symptoms can reduce a person's immunity system?
Again, what is it? Psycho?
Okay. Yeah. Can you please explain why the psychosomatic symptoms can reduce a person's immune system?
Psychosomatic.
Yeah, maybe she means here the psychosomatic. The psychosomatic. Yeah, so just like somebody experiencing a psychosomatic, and then is it related to the reduce of immune system?
Okay.
Maybe you can help to explain.
This is what I understand, right?
Yeah.
So if the patient didn't show symptom or asymptomatic, meaning that usually these patients are healthy, meaning that their immune system is normal. Okay, because different person, they have different strength of immune system. So for example, some patient will show the sign and symptom after 2 days, but some patient will keep asymptomatic until 14 days. So this is depends on individual immune response. So different person will have different strength in immune response. I think that's genetic. We cannot change that.
Okay. So another questions from Norma Aniri, Respira Hospital Yogyakarta. Can asymptomatic coronavirus person can transmit to other people?
Yes.
Okay. Not finished yet.
Okay.
Do we need to do a PCR test for asymptomatic people with a contact history with COVID-19 patients? That's the question. Please.
Right. So the answer is yes. Even though the patient is asymptomatic, so they still can transmit the droplet containing coronavirus to other people that in close contact with the patient, with the one that positive with coronavirus, even though it is asymptomatic. So it is discussed in many papers saying that even the asymptomatic patient also transfer the virus. So that's make this virus different from other viruses actually. Okay, because during that asymptomatic period, it still can be transferred from human to human. So the second question, yes, the one with asymptomatic, even though they don't display any sign and symptom that they having COVID-19, they need to do the PCR, the RT-PCR, because through RT-PCR, we can detect whether there's RNA of the coronavirus 2 or not inside the body. So this will allow us to do early detection and quarantine the patient at home or at hospital to avoid further transmission of the COVID-19. So for example, in Malaysia, the government is actually make a must for certain industry before their workers go back to office or to site to workplace, they need to do a screening test for COVID-19. So at MSU, we have MSU DXLR lab, whereby we did RT-PCR for COVID-19 for these industries. They did send their sample to us. So after they get the result from MSU saying that, MSU lab saying that their workers is negative for COVID-19 RNA, they can resume and go back to work. So that's one of the policy after we finish PKP that day.
Hello?
Hello?
Yeah, it just is interrupted. Okay, we still have 2 minutes left. I would like to invite, I see here some of the, I thought some participants want to ask directly question to you, but just like coincidentally raising hand.
Okay.
Okay. There is another question here. Maybe you can explain about some experts say that the COVID-19 cannot attach to some food and drink. How do you think about this?
Okay.
How long we can the contact time for the virus on the beverage, food and drink?
Okay, I think I come to one paper where they discuss if on metal surface how long the virus will stay, if on the floor how long, and so on. But I can't remember exactly how long the virus will stay. But if I'm not mistaken, it is ranging from like 4 hours to 24 or 48 hours, something like that. Depend on the surface where the virus are. Okay, so this is what they discussed in that paper. Okay, the second question, the fruits and drinks. Okay, so as I agreed with Dr. Jamie just now, so there's no specific ways of cleaning our fruit and drinks from the virus, but we need to follow the recommendation of like our the time recommended for our washing hand times, which is 21 seconds. So by washing this food or drinks under the running water, I think should be okay to protect us from the virus, because yes, the virus can be transmitted through object. Okay, especially for example, the vendor just sneezed and the vendor is positive for COVID-19. Yes, of course, the vendor can transmit the COVID-19 virus through the fruit or drink that they sell. So number one. Number two, I think to prevent this from happen, the vendor should be honest. If let's say they are diagnosed with COVID-19, they should close their shop for a while and quarantine themselves. So that's actually most important to stop the virus from spreading.
Well, thank you very much, Puan Rosida, for your nice explanation. I still have a lot of questions here, but I'm afraid that we will run out of the time. So I hope that you don't mind if we send the questions to your email.
Okay, I'll try
Yeah,
my best.
I find many interesting questions here related to your study, but yeah, it's the time limitation, so we cannot ask all of the questions here. But anyway, thank you very much for your explanation. We really appreciate your for your coming here in our webinar. Hopefully, we can meet again, yeah, face to face directly. Hope, yeah, once the COVID just gone. Thank you very much. Okay, see you again. So we will move to the next presenter. I would like to invite Dr. Gigi Hans Lesmana MKes. Please come to our Zoom room. There you are. Hello, Dr. Hans. How are you today?
Hello, I'm fine, thank you.
Thank you very much. So I would like to read your CV first. Is it okay?
Okay.
Okay. Well, excuse me. Okay, ladies and gentlemen, now we will have a presentation from Dr. Hans Lesmana. I would like to introduce him first. Dr. Gigi Hans Lesmana MKes. His education, Faculty of Dentistry, Hasanuddin University in 1990, finished in 1990. He finished his Magister of Public Health, Hasanuddin University in 2003, and he finished his Doctorate of Medicine, Airlangga University in 2011. His working experience, he worked for Polkesmas Dentist, South Sulawesi from 1998 to 2005, and now he's a lecturer of dental nursing, Makassar Health Polytechnic from 2005 till now. That's all the introduction of Dr. Hans Lesmana. Now, Dr. Hans Lesmana, the time is yours. I just want to remind that your presentation time is 45 minutes and then followed by 15 minutes question and answer session.
Okay.
Please,
thank you.
time is yours.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh. Peace be upon us. A good afternoon and hope we are all in health condition. My Honorable Counselor of Makassar Health Polytechnic, Dr. Agustian Ipa, Jamie Baum, PhD, Puan Rosida Abdullah, Master Science, and Ida Adayani, Master Science as speaker, and Nurse Wahyuni Awaludin as a moderator, all the committee and all the web participation. Now I will presentation our study today. And please the slide, please.
Screen-nya belum kelihatan, Dok. Your screen. Okay.
Saya sudah kirimkan Pak screen.
Yeah. How about this?
Yeah. Okay.
Yeah.
Okay. You can start. Yeah.
Yeah.
Yeah. Okay. Thank you for the time. Our study in September 2019, it's before the pandemic COVID-19. Yeah. Effects of antiretroviral therapy or ART to change in salivary potential hydrogen and plaque index on HIV/AIDS patients. Next. Background. Human immunodeficiency virus is a virus that attacks the human immune system, whereas acquired immune deficiency syndrome is an immune syndrome by HIV infection. HIV is a virus that causes AIDS, which has a primary target cell in the form of T4 lymphocyte cells and has a CD4 or cluster differentiation receptor. Next.
Excuse me, maybe I have to open it from Google Slide. Just take 1 minute, some second.
Yeah, okay. Antiretroviral therapy used to first eliminate replication of HIV, so it doesn't to continue to AIDS phase. Secondly, prevent another infection, attack the immune system and their complication. But the ART have effect to the oral cavity. First, oral white lesion, and secondly, dry mouth. Next, a taste disorder, serostomia, and feeling burning in mucosa. Now, relationship between ART to HIV/AIDS patient with potential hydrogen and plaque index, and relationship between duration of ART on these two variables that we do in our study. Next. The method. We use an observational analytic method with cross-sectional design, then measuring the potential hydrogen of saliva and plaque index in 100 sample of HIV/AIDS patient taking antiretroviral drugs. The research was carried out at Yayasan Peduli Kelompok Dukungan Sebaya, Makassar, Indonesia, and data retrieval last for 6 days. Potential hydrogen saliva is measured using a pH meter. Plaque index was examined after the tip were stained with disclosing solution. Next. Plaque index score determination is measurement result obtained are process analyzed with the chi-square test. Next. And this is the results of our study. Table 1, the relationship between drugs use and drug type on plaque index, duration of use in two group, less than 5 years and more than 5 years, and the totally we have 100 patients. Next. Table 2, relationship between duration of drug use and type of drug on saliva potential hydrogen, duration of use less than 5 years and more than 5 years, and the total is 100 patients too. Next.
Sorry.
Nah, table 3, chi-square test of relationship between type of ARV with salivary potential hydrogen and plaque index, and we can see what the significantly only salivary potential hydrogen, but in plaque index no significantly. Next. Chi-square tests the relationship between duration of use with salivary potential and plaque index, and no significant about less than 5 years and more than 5 years. Next. Yeah, there was a relationship between ART in HIV/AIDS patient with salivary while analysis of duration of ART treatment was less than 5 years and more than 5 years. No significant relationship was found between the plaque index value and the received ARV therapy, but both in terms of the type of ARV and duration of use. The Health Education and Motivation Program conducted by the Caring Support Group Foundation every month have a positive contribution so that the foster residents have the awareness to have a healthy lifestyle, including brush twice a day. Foster residents have access to the designated health facility to carry out special health service to them, including dental health service at Polkesmas and hospitals. Mentoring programs, both motivation and counseling conducted by fellow inmates also have a positive influence on them. Next slide. This is the picture when we are in the foundation of HIV/AIDS. Next, that's the picture where we have collect the data. Next, same location at the Yayasan Peduli Kasih, we collect the data of antiretroviral therapy. Next. And our study conclusion, there is a relationship between antiretroviral virus treatment in HIV/AIDS patient with salivary acidity, namely salivary potential hydrogen with next. While the duration of antiretroviral treatment in people with HIV/AIDS is not related to plaque index or salivary potential hydrogen. If we try to connect in patient with the pandemic COVID-19, a patient with HIV/AIDS must take ARV drugs every day to maintain their body's immunity, including to COVID-19. Next, although ARV has various side effects, including in the oral cavity, and the point that ARVs were considered a risk factor that play an important role in decreasing the level of salivary flow and enlarge salivary gland in HIV positive patients. Need on the use of topical salivary stimulation products to increase the flow of saliva. Okay, this is our study, and thank you very much for your attention.
Thank you very much, Dr. Hans. Yeah, thank you very much for your nice explanation about the result of your research. It was conducted in 2019.
Yeah.
Okay,
September,
so it was September to 2019.
Yeah, before.
So before the COVID comes.
Yeah, before pandemic.
Yeah. Okay. So now we move to the question and answer session. Because we have two places here to ask the question, so I have to find out. Excuse me. So please, ladies and gentlemen, if you want to ask a question to Dr. Hans, you can type your question here in the chat box, or just raise your hand if you want to ask him directly. Okay, there is a question from Muhammad Askar. of Polkesmas Makassar. We know that right now social distancing makes everyone has a fear to close contact with others. Do you think it will reduce the prevalence of HIV infection?
Hello?
Yeah.
Repeat, please. Sorry.
Okay.
Repeat, please.
We know that right now social distancing makes everyone has fear to close contact with others. Do you think it will reduce the prevalence of HIV infection?
Okay.
Yeah, please.
Okay. Thank you for the question from Mr. Askar. And social distancing for HIV/AIDS patient is must do it like initially like all the peoples, not just for the HIV/AIDS patient, but all the people. And for patient with HIV/AIDS, the patient must be very careful because their immune they don't have enough immune like normal people, so they must maybe we can say they must very careful more than normal people, because when they don't use their ARV, or maybe they're late to consume their ARV, their CD4 or cluster differentiation 4 is very low, not like us. They just have 25%, not like normal people. So they must to use the social distancing more carefully. Social distancing than normal people. So all the question of COVID-19 must they do, but more carefully. Not they don't have a normal immune. I think that there's the response.
Yeah, thank you very much for your answer. Okay, the next question is from Farid Rahman. He's asking what is the effect? Is there any effect of physical exercise to HIV patient immune system?
Okay, the effect of exercise of patient with HIV/AIDS. We know the physical exercise is good to increase our immune, but the people with HIV without ARV therapy, they must careful to do it because they don't have enough CD4. Only 25% they have, so they must think about the injury or the effect of the exercise, high exercise. They don't do like normal people. Hello.
Yeah.
So they can do it, but not too hard like normal people. But must do it very slowly and but they must control first how to use their ARV therapy, antiretroviral therapy.
Yeah, so that's the explanation. Thank you very much for your explanation, Dr. Hans. I think time is up now. Thank you very much for your participation. We will move to the other presenter, Miss Ida Adayanti. Thank you very much for coming, Dr. Hans.
Thank you very much.
Yeah, see you again. The next, I will invite Miss Ida Adayanti to come to the Zoom room.
Okay, I'm here.
Are you joining us?
Yes.
Okay. Okay, so I would like to introduce you by reading your curriculum vitae. So would you please, wait for a minute for that. Yeah, I will share the screen. Okay. Yeah, ladies and gentlemen, I would like to introduce our fourth speaker today. Her name is Mrs. Ida Adayanti, SSE MSc Apotheker. She's a senior lecturer at the Pharmacy Department, Makassar of Health Polytechnic. Date of birth, August 29, 1984. Educational background, she graduates from Master of Science in Medical Pharmaceutical Science, University of Groningen from 2010 to 2012. She graduated from pharmacist from Hasanuddin University from 2006 to 2007. She studied Bachelor of Science in Pharmacy, Hasanuddin University from 2001 to 2006. Her work experience, she started her career. She's currently as a head of undergraduate program in applied pharmacy, Makassar Health Polytechnic from 2016 to now. She's a lecturer of pharmacy department, Makassar Health Polytechnic from 2008 till now. She worked as a pharmacist in charge of Safina Pharma from 2012 to 2017. And she works as a pharmacist in charge of Norma Pharma from 2007 to 2012. That's the curriculum vitae from Mrs. Ida Adayanti. Now, Mrs. Ida Adayanti, it's time for you to present your presentation. I just want to remind that 45 minutes for presentation and followed by 15 minutes for question and answer question. Time is yours.
Okay. Yes. Thank you very much. Let me start my share screen first. Okay. Yeah. Let me express my best gratitude to the Chancellor and the Vice Chancellors of Polkesmas and the committee of this international webinar for the opportunity to discuss our topics. To all of our dear participants today, my great respect to the head of BPP STM, Ministry of Health Indonesia, and to all invited speakers who has shared their thoughts about COVID-19. It was very enlightening, of course, and also to Dr. who has presented his valuable research. So let me start my session about the formulation, the adverse effect, and the recommendation of hand sanitizers. So why hand sanitizers? At the beginning of the COVID-19 outbreak, there was huge disruption in any sector of human life. Hand sanitizers became so popular. The demand of hand sanitizers the outbreak. In February, for example, the number of hand sanitizers sold in Indonesia increased by 200%. Wow, it's what's hard. And based on Indonesian online consumers' trend of health products during COVID-19 pandemic, great portion has been taken by hand sanitizers, followed by supplement, other antiseptic, and thermometer. So, hand sanitizer, very popular. We also can see the graph or of the number of hand sanitizers sold in Netherlands in 2009 and 19 and 2012, no, 2020 by week, the first until the third week, the market of hand sanitizer looks likely the same. The rise significantly starting to week 4 until week 6. The number is lower at week 7, not because the demand were decreasing, but the supply was limited. Supply of hand sanitizer couldn't meet the demand. Mostly all the countries might has the same situation. In Indonesia, we also experienced this scarcity of hand sanitizer at the beginning of the outbreak. Even some notice suppliers sold their product at very high cost. Panic buying happened almost everywhere. In another hand, so there's a positive side of this pandemic. Some people become very creative and make their own hand sanitizer because it's rare. We are very hard to find hand sanitizer, and then they publish it on their social media. I mean, so what happened next? Because of their posting. And their posting becomes so popular and viral because if we are posting something on the social media such as Facebook or Instagram, they can repost our posting. But whether the product they made has antimicrobial properties was questionable. The making of your own hand sanitizer becomes so popular not only on the social media but also on TV. Information media sometimes misleading, but through the same media, we correct misleading information, and here we need the expert. Here is some discussion for picture on information how to produce hand sanitizers. From this picture, which picture are misleading information? You could answer my questions on the chat room in Zoom or YouTube. Later on, we will back to the slide again because you will find the answer during my presentation. So, basically, there are variety of dosage form of hand sanitizer. Could be foam, cream, spray. The more popular, I think, is hand and spray. Okay, next. We talk about the types of hand sanitizers. So there are two types of hand sanitizers. It's hand sanitizer and the alcohol-free hand sanitizer. The WHO recommend alcohol-based sanitizer, or let's just call this alcohol hand sanitizer apps because it's quite hard for me to always repeat this word. So the WHO recommends the apps in line with the proven advantages of their rapid action and a broad spectrum of microbicidal activity offering protection bacteria and viruses. However, the effectiveness against non-enveloped viruses is still debatable. Effective hand sanitizer are apps containing 60% to 95% of alcohol, as it is capable of denaturing proteins of microbes and inactivating viruses. And apps may contain one or more types of alcohol, with or without other excipients and humectant to be applied on the hands and destroy microbes and temporarily suppress their growth. Apps can effectively and quickly reduce microbial germicidal spectrum without the need for water or drying with towels. However, there are few shortcomings with the effectiveness of apps, such as its short-lived antimicrobial effect and weak activity against non-enveloped or eosinophilic viruses and bacterial spores. So that was the shortcomings of the ethanol. On the other hand, or alcohol, I mean, on the other hand, alcohol-free sanitizer using chemicals with antiseptic properties, you can see it on the yellow cycle, to exert the antimicrobial effects. These chemicals have a different mode of action and function according to their chemical functional of groups. So we will discuss this later on the next slide. So here is the chemical classification of commonly used antiseptic in hand sanitizer and their mechanism of antimicrobial action. The first group is alcohol, for example, ethanol and isopropanol. The mechanism of action is by denaturation of proteins in the plasma membrane. The second group is chlorine compounds of the second group is chlorine compounds, for example, hypochlorites, chlorine dioxide, and chloramine tetrahydride. And the mechanism of action through halogenation or oxidation of cellular protein. The third group is iodine compounds such as povidone iodine, I'm sorry. The mechanism of action is iodine can easily penetrate through the cell membranes of pathogens, followed by attacking fetal proteins, nucleosides, and fatty acids of cell. The next group is quaternary ammonium compounds, for example, benzalkonium chlorides, including alkyl dimethyl benzyl ammonium chloride, benzyl dimethyl octyl ammonium chloride, and didecyl dimethyl ammonium chloride. The mechanism of action is by lowering the surface tension, inactivate enzyme, and degrade cell protein. And the next group is peroxygens, such as hydrogen peroxide and peroxytic acid. The mechanism of action through free radical oxidation of essential cell components. Next group is bisphenols, such as triclosan, and the mechanism of action by penetrate the cytoplasmic bilayer. Next, the last group, we have biguanide, for example, chlorhexidine, and the mechanism of action through ionic interaction and disrupt cell membrane. So, let us move to the next slide. So the next slide is about the formulation composition for compounding the apps based on the United States Pharmacopoeia, or we usually call it USP, and the HWO recommendation. Here we see three formulations. The first formulation using ethanol, 80%. The second and the third formulation using isopropyl alcohol, 75%. The differences of the two latest formulation is the initial isopropanol concentration, for the two using 99% and for the three using 91%. But at the end of the dilution, they make the same concentration. The next ingredient is hydrogen peroxide, 3%. This peroxygen will enhance the antimicrobial activity of the apps by inactivates contaminating spores in the bulk solution or excipients. The next excipients is glycerol as humectant, so it to moisturize your hands after using alcohol, because when you put alcohol on your hand, you feel dryness. So finally, we could add some water, not could add some water, but we're adding water to sufficient quantity to make the last volume of the app. So in this formula, we make a formula of hand sanitizer for 1 liter volume, yeah? So after that, you will have your hand sanitizer based on the WHO recommendation. So we see that there is an exact quantity of ingredient and a special dispensing method, and how we dispense of all of these ingredients. Actually, you can find the guidelines by searching it into Google. Gets so many guidelines, but you have to make sure that the guidelines is the WHO recommendation, right? So please bear in mind that you should follow the instruction correctly. There's an art of compounding in dispensing sanitizers. Detailed instructions should be followed. So finally, you purchase hand sanitizer with antimicrobial activity. So here is my beloved college in pharmacy department with their extra care handling in formulating hand sanitizer. We have apotheker Santi Sinala, who formulated aloe vera gel into hand gel. Aloe vera has antiseptic properties which might enhance the antimicrobial activity of ethanol. So basically, the formula also use the 70% alcohol. And next we have apotheker Dr. Cecilia Rante Pakadang. Here is the beautiful formulated Sapan lignum into hand spray. Sapan lignum has been empirically used by Bukinese and Makassar tribes in Sulawesi. Usually they boil the Sapan lignum with water and you will have reddish drinking water. The Sapan lignum has some properties as antioxidant and antiseptic, and I think many others pharmacological effect. Next, we have Apotheker Jumain and our students and college in pharmacy department that I couldn't mention one by one, who produce hand sanitizer based on WHO recommendation, and it was used internally in Polkesmas at the beginning of the outbreak, where it was very hard to find any hand sanitizers on the market. Even if you got one, they were so expensive. So we back again to this misleading or correct information. So I already have the answer in this slide. Who got the right answer? Congrats to you if your answer is correct. Now, can you tell why would the first and the second picture are misleading information? So you could also put your answer in the chat room, and I will go to the other slide, because basically you get the answer from my presentation. Now, alcohol and soap. Let's talk about alcohol and soap. In this slide, we see the illustration of alcohol and soap in killing pathogens, bacteria, and viruses. When you apply hand sanitizer on or soap on your hand, they will inactivate the bacteria and viruses by lipid membranalysis and release of intracellular content, and then the virus and bacteria is died. Okay. Now let's see the against coronavirus. On this table, we see the efficacy of different types of apps at various concentration against SARS-CoV. So it's SARS-CoV, not SARS-CoV-2. The virus SARS-CoV-2 is termed due to its genome sequence's similarity to SARS coronavirus. The CoVs belongs to the same genus, beta coronavirus, and they share similar morphology in the form of envelope, positive single-stranded arenaviruses. The 2015 WHO model list of essential recommended ethanol at 80% volume for volume and isopropyl alcohol at 75% volume for volume under the category of disinfectant alcohol-based hand rub. Ethanol 60 to 85% appears to be the most effective against viruses compared to the isopropanol 60 to 80% and propanolol 60 to 80%. The study conducted with WHO recommended alcohol-based formulation demonstrated a strong virucidal effect against emerging pathogens, including Zika virus, Ebola, SARS-CoV, and MERS-CoV. Another study conducted in Germany found that the ethanol in the concentration of 42.6% week per week, so it's not volume but week per week, was able to destroy SARS coronavirus and MERS coronavirus within 30 seconds. The efficacy of various alcohol-based sanitizer at different concentration, you can also see it on this table. So, let's talk about the adverse effect of the apps. The most commonly reported skin reaction with the use of apps are irritant contact dermatitis or ICD and allergic contact dermatitis or ACD. The symptoms of ICD can range from mild to debilitating with manifestation like dryness, pruritus, erythema, and bleeding if severe. As for ACD, the symptoms can either be mild and localized or severe and generalized, with most severe forms of ACD being manifested as respiratory distress or other anaphylactic symptoms. Hand hygiene products such as sanitizers and soaps can be damaging to the skin through several mechanisms by denaturation of the stratum corneum proteins and alteration of intercellular lipids and decreased reduction of stratum corneum water binding capacity. So that was that is the adverse effect. And among the alcohol-based formulation, ethanol has the least skin irritant property compared to propanol and isopropanol. So ethanol is more effective than isopropanol and propanol, and also they less skin irritation. So ethanol is the best option. And also, please be aware of certain hand sanitizers containing methanol instead of ethanol. So some producer said that it is hand sanitizer made from ethanol, but actually it's from ethanol, and very toxic. So there is a case in X city, I don't have to mention which city, where a naughty chemical supplier sold methanol as ethanol to the doctors, nurse, and many more health professionals. Those people who purchased the methanol labeled ethanol are at high risk of experiencing adverse effect of ethanol toxicity. So please be aware and purchase any chemicals only from reliable supplier. Okay, so these are some recommendations to minimize the cutaneous adverse effects. The adverse effect caused by sanitizer or hand washing soap can be easily prevented by identifying the trigger and countered with appropriate measure using one or a combination of following methods. First, you have to select the product with less irritating agent. So it's better if you are, for example, allergic to alcohol, then you have to choose the alcohol-free hand sanitizer. That's for the example. And every time you have wash your hand or using hand sanitizer, you have to moisturize your skin using lotion or moisturizer. And you have to avoid any habits that cause or aggravate skin irritation. And we come to the hand hygiene recommendation. So actually, proper hand hygiene by washing hands or using wait. Yeah. So proper hand hygiene by washing hands or using alcohol is one of the most critical measures to prevent direct or indirect transmission of the COVID-19, as it reduces the number of viable virus on contaminated hands. The CDC, or Center of Disease Control in America or USA, recommends washing hands with soap and water whenever possible because hand washing reduces the amount of all types of germs and chemicals on hands. If soap and water are not available, using a hand sanitizer with a final concentration of at least 60% of ethanol or 70% of isopropyl alcohol inactivates viruses that are genetically related to and with similar physical properties as COVID-19. The action of hand washing can mechanically remove the microorganism, but the removal of resident pathogen is more effective when hands are washed with preparation containing antimicrobial agents. So, according to the policies and procedures on CDC and WHO, the recommended duration for the entire hand wash procedure spans between 40 to 60 seconds using the standard step technique. So, yeah, so this is the main reference of our discussion today. And before the end of my presentation, on behalf of pharmacy department, let me send my best regards to Mr. Ronnie Horax, who has facilitated this webinar, international webinar, and for Mr. Muhammad Saud and Madam Hiani Salim and Madam Hasna Ibrahim. Even though all of you have retired from pharmacy department, but all of you are in our heart and always become the family of pharmacy department. And last, thank you very much for your attention and your enthusiasm. So please, the moderator, I already ended my presentation.
Thank you very much, Mrs. Ida Adayanti, for your nice and beautiful presentation. Yeah. So now we move to the question and answer session, and I also have a lot of questions here.
Oh,
how are you? Yeah.
Well, pick up the easier question.
Okay, because everybody just want to know everything about the hand sanitizer and everything. The disinfectant agents is really critical now because some of the, some wrong information throughout the social media just lead the people to become confused. Yeah. So this is the first question from Tenriwali. She's from Akbar Mapaudang, Makassar.
Okay.
She's asking, is the use of hand sanitizer can be clean our can be protect our hands for longer time.
Okay.
I mean they only rely to the hand sanitizer rather than the cleaning hand by soap. Maybe this is happen if the hospital facilities has lack of water and soap. This is for example. So they just rely to the hand sanitizer. How do you think about this?
Okay, so as I mentioned before in my presentation, that the shortcoming of the apps is the effect of the antimicrobial activity is not for long on your hand. So you always have to clean your hand or wash your hand. So if you couldn't find any water and soap, then use the hand sanitizers. So that was my answer. So it will be very difficult if a hospital don't have any water. And I think for now, all the hospital already accredited and water supply is the most crucial thing. So, well, that's my answer.
Yeah.
So coming of the sanitizer.
Thank you very much. So another question is from Yaumil. She's from Makassar Health Polytechnic. Her question is, which one is the best formula? Hand sanitizer in gel or in spray formula? Is there any other formula with no alcohol composition, safe for human as antiseptic?
So basic antiseptic is topical use, and if it is a marketing to the community, it means that it is safe because we have BOM who always make sure the safety of all the products. But however, sometimes we as the consumers couldn't what I mean that the BPOM actually already have the recommendation that do not buy any product that has not any so it's back to us whether we buy the good product or the bad product. So actually, if there is no BPOM legalization, it could be bad because it's not in all the industry have quality assurance and quality control, and the BPOM is our FDA in the USA is FDA. In Indonesia it's BPOM. Then they always mengawasi I forget.
Yeah, to watch,
all
to supervise.
all the supervise all the pharmaceutical component that used by the community. So did I answer all the question or some missing? Because I forget.
You're all right. Okay, so the next question.
Oh yeah, I remember.
Yeah.
You always have option if you're allergic to alcohol-based hand sanitation. You can pick up the alcohol-free sanitation. Yeah, that's the answer for the option.
Yeah. Okay. So which one is the best? The alcohol solution, right?
Well, if based on the WHO recommendation, they recommend the apps. The apps. The apps. They recommend the apps, and you have to make sure that the concentration of the ethanol is between 60 to 85%.
Okay, clear enough. So we need to really pay attention to the hand sanitizer products that sell in the market. We have to find out about the contents of the alcohol inside. Okay.
Yeah. Actually, I haven't answered this. I haven't explained the whole through the presentation. One is misleading information, because here they put 1 tablespoon of alcohol 70%. So first they use the diluted alcohol. So actually alcohol 70% is antiseptic. So when you only use 1 tablespoon of alcohol 70% and the addition of another ingredient, so the alcohol will be diluted more and the final concentration of 70%. And if the concentration less than 60%, it means then it's not a hand sanitizer. I don't know what kind of product is that.
Yeah.
The same in this picture. In this picture, if I read the blog, so he used alcohol 70% and aloe vera gel. So 100 ml, there's an exact volume. Okay, 100 ml of alcohol and 150 ml aloe vera. So it means that the alcohol is diluted 2 times. So the more than 2 times. So at the final product, this product will have the concentration of alcohol less than 40%. So I don't know whether on hand sanitizer or only aloe vera gel with addition of ethanol. Yeah. These 2 pictures is correctly. So if you want to find how to make your hand sanitizer based on the WHO recommendation, look at this video. Both of this picture is done by pharmacists. So here we see that he used hydrogen peroxide test, and all the ingredient measured exactly, just the same as in this video. So this is the answer of what we discussed. Yeah.
Wow.
Is there any?
So it just like I mean, we can see in Indonesia, the hand sanitizer products is just selling really everywhere, and most of them just like it's a house product, not yeah, not registered by the BPOM. So we're just afraid that they just put something without the very correct ingredients inside, and then they just sell it as a hand sanitizer. Okay.
You make sure that who made the hand sanitizer is the expert, because some of us donate the hand sanitizer at the beginning of the outbreak, and it was formulated based on the WHO formulation, so that's okay. But if you make your own hand sanitizer, please follow the rules. Basically, in this pandemic, it is okay to make your own hand sanitizer, but of course, if you make hand sanitizer, you want all the pathogen, bacteria, and viruses died, right? So if you use a hand sanitizer that has no antimicrobial activity, why you want to put it on your hand?
That's right.
Yeah.
Yeah. Well, thank you very much for your brief explanation, nice explanation. We move to the next question. The question is from Yatilka Eskap. Question to Apotheker Ida Adayanti. Is there any impact from sanitizers when used for long periods of time?
Basically, I already present the adverse effect of the hand sanitizer, but you can reduce the effect by using moisturizer after using hand sanitizer, because in apps there's alcohol, and alcohol make your skin dry, so you have to moisturize it again. So actually in the formulation, it consists of ethanol and then hydrogen peroxide. So ethanol is the antiseptic, so it is the main active ingredient, and then there's hydrogen peroxide to enhance the activity, and it is quite good for spore, because ethanol is not really good to the spore or to the non-envelop viruses. So the hydrogen peroxide enhance this activity, and then there's glycerol, so it actually moisturize your hands. But if you feel that your hands is still dry, then just put on lotion on your hand. And the other recommendation is that pick the you're not allergic to. So if you try one hand sanitizer and you feel that you have allergy to that product, then find another product.
Yeah.
Yeah.
Thank you. Okay. Another question from Mrs. Haironisa from Nutrition Department of Makassar Health Polytechnic. She is asking, what do you think about people's assumptions that hand washing habits too often will actually reduce the level of immunity to microorganisms?
Well, it might kill your normal bacteria on your hand, but I'm not really sure that it will reduce your immunity. I'm not sure of that.
Yeah.
Because the recommendation of hand hygiene actually is already recommended way before this pandemic, but we just neglected the guidelines, the recommendation. We didn't care about that. We didn't care about this recommendation. And finally, when the COVID-19 outbreak, everyone want to buy the hand sanitizer, while before you don't care about that.
That's keren.
Okay.
Okay, so next question from Dr. Gigi Rini Sitanaya from Dental Nursing Department. For food like fruits or vegetable, what kind of antiseptic we can use? How about the food from delivery or we take away from the restaurant? Should we sterilize it first or just spray antiseptic on its packaging?
Well, so for the fruit, I think, well, actually, as I usually doing research about the skin of the fruit, so the skin of the fruit basically usually have antioxidant properties more than the fruit. So actually, I want to recommend then maybe you have to peel the peel of the
The
fruit,
skin.
but there's antioxidant in that, so it's quite. But I'm afraid that if you wash the fruit with the soap, then some some vitamin or some chemical that act as antioxidant or have a good pharmacological effect will also diminish. So it's better to use just water, or maybe you want to use warm water, or if you're not sure, just make sure that the supplier where the place you buy all your food is free of viruses maybe. Well, even though it's very hard, of course, and to make sure the about the food that we buy through Grab. So if you choose to buy the food, then you have to take the consequence of how they produce their food. So just make sure that you buy the product with a good supply. Yeah. So I think that's my recommendation, guys. It's very hard if you didn't see how they produce their food, right?
And then what's your recommendation for takeaway or delivery food? Should we sterilize it, the packaging?
Well, it is the same with the answer of Dr. Bong, that if we do the overheating, we didn't get any nutrition from food.
Yeah,
So
that's the point.
it's depend on you. Do you want more nutrition on your food or not? Yeah.
Okay, thank you very much for your explanation.
Okay.
Next question from Farid Rahman. Good afternoon, Ibu Ida. I would like to ask about hand sanitizer. How many times we can use hand sanitizer in one day? Is there any time limit for it?
So basically, the effect of the ethanol is short. So that's one of the shortcomings. So you can use it many times, but I think if you use it many times in a day, then your skin will dry. So that's the effect. So just make sure that your hands always clean, and always use water and soap first. If you couldn't find water and soap, then you use the hand sanitizer.
So still the soap and water is the prioritized, yeah?
Yeah, if you have the soap and water, just use it. If you don't, then use the hand sanitizer. Even though that WHO said that hand sanitizer way more effective than the water and soap, but we see that the mechanism between alcohol and soap is basically the same. So but why that we recommend soap and water? Because we use the soap for the antimicrobial activity, and then after that it diminished by the water. But for alcohol, so actually alcohol is very favorable. So when you put it on your hand, it will be favorable. Yeah.
Yeah, thank you very much. Okay, the next question is from, he doesn't mention his name here. He's from Instalasi Gizi. I have yeah, I have hand sanitizer and the ingredient are benzalkonium chloride, propylene glycol and disodium etta. There is no alcohol here. Is it good for clean our hands from COVID?
Oh, that's the second type of hand sanitizer. So we have two types of hand sanitizer, the apps and the alcohol-free hand sanitizer. So benzalkonium chloride is the part of chemical compound that I mentioned before. So it antiseptic properties. So it's okay to use that. So it's another kind of apps. I mean, and the other type of hand sanitizer. It's alcohol-free.
Okay, thank you very much for your answer. Then this is the question from anonymous attendee. How we as a common people, yeah, so he doesn't mention her name here, his name or her name, I don't know. It's anonymous.
Okay.
Yeah. How we as the common people can differentiate between methanol or ethanol as a solvent. Maybe he wants to make their own hand sanitizer, so he just asked you how to differentiate the methanol or ethanol.
Well, if you're common people, you cannot do that because you have to do
that's the point.
you have to do that in the lab because ethanol and methanol is very similar.
Okay,
it's very similar. It's in one group, so you have to do it in the lab. So you have to do the qualitative test for that. So the cases that I mentioned before, that in CTX, actually I get this information from my friends who work at the BPOM. So because many people want to make their own hand sanitizer, so the active ingredients is also scarce. So the ethanol price is also very expensive, and we couldn't. It's hard to find ethanol everywhere, and then that's why maybe they sell the methanol as ethanol because of very demanding of ethanol because they want to make their own and so after that the BPOM find the product and test and it revealed that actually it's not ethanol but it's methanol, so it's very dangerous.
Okay, thank you very much for your answer. So I think this is the last question from Seriaktini Hasma. I don't know where she's from. Oh, she's from Nutrient Department of Makassar Health Polytechnic. Her question is, when I visit an area, the visitors must spray disinfectant around their body. And is this appropriate that disinfectant are good for preventing COVID-19 rather than hand sanitizer? Or is there any recommended method which appropriate for this problem?
Well, actually, in my opinion, the use of disinfectant on your body is not recommended. Because you know that there's the difference between disinfectant and antiseptic. So antiseptic use to your hands. Disinfectant you use it to the, for example, the floor. What? So the comparison is different. So it's not recommended, I think. So if you spray on the floor, on your table, it's okay. But if you spray to people, please be careful. It's not appropriate. We use our clothes, so it's protect us, protect our body. Our clothes already protect our body, and then we use masker. It protects our nose and our mouth, and then we always wash our hands, so it protects our hands. So we already protected actually if you do the COVID-19 protocol. So why you want to spray that on your body?
And it's dangerous, yeah?
On your clothes after you use it, or actually when you wash your clothes, then it already kill the bacteria, because basically the SARS-CoV is the coronavirus, so they have crown, and their crown, if dissolved, will be dissolved, and their lysis, so they died.
Yeah.
Okay.
Wow. Thank you very much for very nice and clear explanation. Hello?
Yes.
Okay.
Yeah.
We still have a lot of questions here, but it's about a time limit, so I cannot ask all of the questions here, and I don't. Yes.
Actually, you have friends, pharmacy. You can ask them. You know the answer.
Yeah. Okay, so hopefully you don't mind to answer the question through email, because we have some question from the other participants from other provinces. So maybe they will send an email to you. Yeah. 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 Thank you very much for your participation, Ibu Ida. And this is that's all of the presentation from 4 presenters. Before I close this presentation and question and answer session, I would like to give a brief summary of our webinar today. That the COVID-19 has bring us into the massive changes into the human lives. While some other countries facing the food scarcities and the other countries are facing the increased number of obesity cases, but both of these problems are triggering the risk of infection from the COVID-19. We need to keep our health we need to protect our family and ourselves by keep living in healthy lifestyle, washing our hands and everything, washing hands, and just keep our body clean from the virus. We can use soap and water. That's the prioritized. But if we don't have that, so we can use the hand sanitizer. We have learned about the immune pathology of the COVID-19, so we know how to improve our immune system in our body. Just increase our health, mental health, then reduce our stress. So I think that's all of the summary of our presentation today. For our 4 speakers, thank you very much for very nice contribution. Hopefully we can meet again at the other webinar. For now, I am Sri Wahyuni Awaludin. Thank you very much for all of the participants for still keep attending this webinar until the end of our presentation. And now I would like to back to the Master of Ceremony. Please, Mrs. Yong.
Yes. Thank you to moderator has guided the presentation session today. The topic presented today is very interesting and awesome. So much of the knowledge we get from the topic delivered by our speakers. Okay, ladies and gentlemen, now the next agenda was the closing remarks from the Vice Chancellor of Makassar Health Polytechnic, Dr. Rusli, FRS APT. Time is yours.
Thank you, Yomil. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi.
And good afternoon. In this closing moment, let me, Vice Chancellor of Academic Affairs in Health Polytechnic of Ministry of Health in Makassar, to convey many thanks to all speakers. Committee, participant, and all of contributors for this international event, so the event has been running well as scheduled. This international event is not their last event, but will continue to international event series to bring Polkesmas Makassar vision into reality, especially as the Center of Excellence on urban health. Today, we face COVID-19 pandemic and transformation from conventional learning to virtual learning and for sustainability. Makassar Health Polytechnic constantly has to adapt and change its strategy to be survive in the future. The last, on behalf of Makassar Health Polytechnic, we do apologize if there is any unintended mistake during this event. And once again, thanks to your participation in this event, and please become close to our next event in the future. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thanks to Dr. Rusli SFRS APT. It's the end of international webinar event organized by Makassar Health Polytechnic. This event is collaboration of Makassar Health Polytechnic with professional organization, Indonesia Pharmacy Association, Indonesia Nutrition Association, University of Arkansas USA, and Management Science University Malaysia. Thanks you to all speaker, comment, and all participants of the webinar international. We apologize if during the implementation of activities there were some shortcomings. We'll meet again at the next international webinar. Ladies and gentlemen, just for information, the attendance link and a certificate have been served by the committee in chat room, in Zoom, and YouTube. Thank you very much. See you next time. Usikum manapsi bitaqullah wallahu musta'an fastabikul khairat. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Miss MC, I think we can have a photo session. We can ask the participants to open the camera, and then we can make the we can make the photo session together.
Yes, you can. You can do it.
Ladies and gentlemen, would you please open your camera? So we're going to have the photo session together. Okay. The host, can you please help, because I just can't see the panelists here. I just can't see the panelists, not the participants. Halo?
Oke, lagi di add satu-satu.
Oke. Okay, so for the first page, please open your camera. Deviana BBPK Jakarta, Iksan Dermawan, Hairani, Wisartika, Mira Andini, Ambarwani, Alfia Husnun, Andi Nur Alam, Anita Kristanti, Dewi Sri, and Devita. This is the one page, the first page. Please open your camera and give our nice cheer. Hello? Yeah, 1, 2, 3, cheers. The next page. Okay. Please open your camera. Wisartika, Ambarwani, Alfia Husnun Salsa, Andi Nur Alam, Dewi Sri, Devita, Dr. Edi Murwani, Siti Mutia, Siti Nurjana, Ernita, Lorencia, Ahmad Yani, Glodia, Halisa Gizi, Haji Muhammad Tahir, Hepitro AMD GZ, Sri Hartati. Please open up your camera and give your nice smile for us. Not open yet. Hello. Please open your camera. Ambar Wani, Andi Nur Alam, Dewi Sri, Dok Ahmad Yani, Siti Mutia, Adisti, Sri Hartati, Fitri Nandalia, Glodia, Halisa Gisi, Muhaji Muhammad Tahir, Happy, Melani, Mita, Muhammad Lutfi, Miftah, Niputu, Sri Ermaya, Nurul Ainon, Nurjana. Pak Roni, show up your face. Okay, I think that's all. Thank you very much for your participation. See you again at our next webinar. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Hey, congratulations Bu Uni.
Thank you very much. Mbak Ami, thank you very much for coming. Nice to see you again.
Great to see you.
When will we meet again, yeah? We just meet through this webinar.
Maybe we should hold this sometime.
Okay, bye-bye everyone. Thank you very much.
Bye-bye.
Bye-bye. See you again for our next webinar. Pak Roni baru muncul.
We should do this sometimes with the group NHPO.
Yeah, that's right. We need to make another webinar for the adjudicator of NHPO.
Yeah. Especially for Aju Magang like me.
Oh my God. You're kidding me.
Okay, Bu Uni. See you later.
See you again. Thank you very much, Mbak Ami. Yeah, good luck for your career. Good luck for everything.
Bye.
Bye-bye.